And Amy, if you take the roll.
Sure. Carla Pohl. You're on.
Present.
Susan Schaefer.
Yes, I'm here.
Hannah Eisner.
Present.
Corey Tello.
Here.
Judy Buchanan.
Here.
All right, everyone's with us.
All right, so the next item on the agenda is approval. We have 2 sets of minutes. I think we probably ought to take them in separate motions because one was a joint meeting with the Mental Health Advisory Board and the other was just a meeting of this committee. So do I hear anybody want to move to approve the joint meeting minutes from September 25th, 2020?
I so move.
And a second?
Second.
Okay, any discussions, additions, corrections to those minutes? All right, hearing none, all in favor to approve them, say aye, or I guess roll call.
Okay, Judy Buchanan moved it first.
Yes.
Carla Pohl seconded it.
Yeah. Okay.
That's correct.
All right, just helping with the minutes. Susan Schaefer,
Yes.
Hannah Eisner,
Yes.
and Corey Tello.
Yes.
All right, let's move on to the meeting of the October 8th, 2020. Do we have a motion to approve those minutes?
I so move.
Corey moved. Second, anybody?
I'll second.
Okay, Judy, second by Judy Buchanan. Any discussion? All right, hearing none. Amy, please call the roll for approval.
Sure. Carla Pohl,
Abstain.
Susan Schaefer,
Yes.
Hannah Eisner,
Yes.
Corey Tello,
Yes.
Judy Buchanan.
Yes.
All right, I guess that brings us to the real purpose of this meeting, which is to try to figure out what we want to do as far as recommendations for the 2021 grant funding. Thank you, Amy, for providing that document with the kind of synopsis of each of the embedded school proposals and the current staffing in the schools for school psychologists, counselors, guidance counselors, social workers, etc. And then we did receive a spreadsheet that indicated what agencies were offering to do in response to our request to amend some budgets. And clearly we didn't get much movement on that. A couple changes, path seems like. So question for you, Amy. I wasn't clear when the path that would require them to reduce their person to part-time, correct? You had some notes on the side.
Yeah, so with PATH, if they did the reduction, so if you guys approve the reduction versus the full amount, with the reduction, they wouldn't be able to do the texting because they need that additional supervisor, that on-call, during the evenings, supervisor to be able to have the support for texting. And so, so if you guys approve the revision, they wouldn't be able to do texting service.
Okay. All right, so I don't know how we necessarily want to begin. I think from last meeting, I think we were all of the mind with the exception of the 4 that we already identified as being not fundable this year, either for lack of resources or just new programs. We want to keep supporting the existing ones. We thought all the programs and proposals merited some level of funding. So we're in that kind of position now. I don't know if anybody came up with any suggestion. I kind of did a small spreadsheet myself, but I don't want to influence discussion. So I don't know if we want to just take a shot at it. Yes, Judy.
Well, go ahead and finish, because I have a couple of questions on some of these.
Okay, why don't we see make sure that we're clear on where we are now. So go ahead, Judy.
Okay, well, it appears that Baby Fold, they did reduce, and I understand that. I need some clarification on Chestnut for Fairview and Sugar Creek. It appears to me that they are saying they will not provide the service if they receive any reduction. Is that your understanding? Okay.
That's how I read it as well.
And I could not locate my my document that gave us a picture of the student population in any of the schools. Where is Fairview and Sugar Creek? Were they on our priority list last time? Because I know we looked at some schools we thought we probably could set aside. Where do they set in terms of priority of need?
They're quite high. I can pull that document here just a second if I can find it fast. Oh shoot. I have 3 binders. I have to figure out which binder it's in. Oh my goodness.
I need to go to the binders.
You talking about the school report card, the summary document that Corey provided us last time?
Right.
Because we did use that as some point of reference,
I'm still having big issues with that costing so much more than.
Talked about it this time. Mm-hmm.
I'm not sure that something else, we should encourage perhaps another avenue to work that, to provide that school with services, those schools with services, because I just don't understand the difference between others being able to do it for 20 and them needing 60.
Mm-hmm.
And actually, I'm just very confused.
I guess I took that to mean, and I get to second Susan, that the other schools are using some other funds to support the position, and that Chestnut, that would be the cost of a full-time person, I think.
But still, they do get, but they still, remember, are able to get, some of those services are billable. I mean, a significant amount of those services.
I took their request to indicate they needed the money to support, and their comments suggested to me too that they were expecting to pay this entirely with our funds. So
Fairview has between Fairview and Sugar Creek, they have a total of 769 students between the two of them. Fairview has a low income of 48%. Sugar Creek has a low income level of 57%, which is, not as high as Cedar Ridge at 74%, Oakdale at 68%, Fox Creek at 63%. And let's see, Irving and Sheridan at 80 and 82%, et cetera. So it's not, although certainly significant, I never mean to minimize the needs of any of these schools. It is not as significant as some of the others. The difference is that some of the other elementary schools with higher low-income percentages are partnered as a grouped entity with junior highs that do not have nearly that much low income. For example, Oakdale at 68% is partnered with Kingsley, which has 29%. So again, that's why sometimes I'm almost wondering, and Hannah, you talked about, like giving this to Regional Office of Education and letting them decide. My comment about that is this is perhaps not the year to lay one other burden on the schools, because believe me, in the work I'm doing with schools, they are treading water, and to ask them to take on another thing is probably not a good idea. So I think if anything, we give a chunk of money. We say we're going to pay for X number of entities, and we give it to Center for Human Services and say, we're giving you this chunk of money for you to decide which of these schools you've put out there, because they also would know right now which schools are able to be to really use these services maximally, because that's the other problem with everybody going back and forth between remote, in-person, hybrid. You know, each school probably is less or more amenable to using the services fully. So it might be almost better to just say, give a chunk of money to Center for Human Services and say, you know, we expect you to, with integrity, make the best possible decisions, but also base it on who are you really able to deliver the services to under these unique circumstances.
All right, so Susan, you had your hand up, and then Judy.
I have two things. One, the amount that Chestnut's asking for would actually cover like 5 or 6 other schools versus 2. So I think that that's one thing to consider. But before we actually decide on where to take that, whether, I think we should just kind of eliminate, and I think that that's what we're trying to do here, and eliminate, or definitely say we're going to definitely fund certain things that we know that we want to fund, and then go work our way down from the balance that we have. That's just kind of my suggestion.
Yeah, I think that's a good idea too.
That probably has, I mean, not probably, it does have merit, Susan. If I could just go back before we do that, you mentioned under Chestnut that there are 5 additional schools in addition to Fairview and Sugar Creek that also would be receiving part of the $62,000 worth of services. Where is that? Did I miss that?
No, I'm just saying that the 62,000 that they're asking for, if we had all of this money, and we were just down to doing embedded schools and had 60-some thousand, that would, instead of 2 schools, we would be able to cover more schools. And the thing with the elementary and the junior high, even though not as low income at the junior high level, is the continuity of counseling from when they transition from an elementary school to the junior high. So that's why I was saying, instead of getting too far deep into the embedded schools and that kind of thing, about eliminating anything and then figuring out which ones we would fund.
Yeah, Susan, I think that's a good idea. I mean, I think it's just, it's a math problem right now.
But can I just make sure we clarify for the audience that anybody's listening? So Susan, you are not saying that in Chestnut's proposal, they're proposing to pay for 5 schools. You're saying, no, because I misunderstood as Judy did. It made it sound like they were saying that they would, for $60,000, they would pay for those 2 schools and 5 others. That's not at all what you meant. So I just wanted to make sure that anybody listening was clear on that. Because
right, it was just using the comparison of how many dollars there were that they were.
Okay.
So Amy, if you could put that spreadsheet up and share it so we can see it, I guess. I mean, we all have a copy of it. I just think sometimes it's easy to look at it together, but if it's hard to see, then there we go. And I guess what I'm going to suggest is that we just go down it one by one. I think Susan's point is well taken. Let's see where we stand after we go through this. So our first is a Healthy Start. They requested 90.
Could I make a suggestion, Hannah, that maybe we talk about, we each, instead of going one by one, we first start by saying, are there any that we all have consensus that we can eliminate? Because then that tells us what might be left. I mean, I'm almost wondering, like we did with the first round where we automatically eliminated 4. Are there any now, as we've had time to think about it, and also now that we know where reductions are available and that no more reductions are going to come our way, are there any now that we can eliminate and start there?
Well, Corey, what I'd suggest is let's talk about each of them, and we can, at the point you get to that, say, I think this one could be just not funded. We can go back and forth. We're not going to make final decisions. So, because some of this may have some bearing on if we cut somewhere, we may have money available, et cetera. So,
Okay.
if you're okay, I mean,
Okay, that's fine,
Mike.
that's fine.
kind of keep us track. So with youth services, Healthy Start, they've offered to cut about 13,000 from the budget. And, they were asking for, significantly
77.
more.
They were asking for 90 and they went down to 77 too.
Yeah, and that's closer to what they received last year, I believe. So I don't know what people feel like. Do you want to say we would like to use their new number as a funding level for that? Or is there anybody who feels that this program should not be funded? So I'll just open it up.
I'd say fund them at 77 with
Right.
that new request.
Mhm. Because they have offered to really go to recover the additional costs another way, which says that they all have value, but they understand. No, I support that, Susan, too.
I can't comment on them. I
Yeah.
have conflict of interest.
Right. So, sorry,
I support
sounds
that,
like,
Susan.
Carla, do you have any different feelings? I agree with the other two. So consensus
with-
would be we go with that. So the next one then is the PATH program. They asked for more to create this new position, and now they're offering to cut, which, I appreciate the fact that they actually looked at it and gave us a response.
Mhm.
I don't know what people feel like, whether you want to accept that as okay, let's reduce them. I think we've always said we thought PATH was a worthwhile program, but I'm just going to open up. I'm going to stop talking. So
I think that particularly in these times when that is the one place where you can at least talk to someone. You may not get the assistance or the help you needed, but that is kind of central to the pandemic and the unrest and the unsettling nature of what our lives are like now, as well as the potential for really invigorating texting. I know that PATH is receiving a lot of calls on behavioral health and other issues, and they are strained, and they recognize texting is going to really even increase that. But if you think about the social media platforms, including like texting, that's where people are right now. So I'm fully supportive of funding them at the requested level.
you mean the original amount,
Actually, the
87?
yes, correct. Mhm.
I would concur with that. I feel like they are the hub, and we've been talking about since some of our social service agencies are at capacity for certain for clients that are funded through certain channels, because PATH then becomes the only thing that's kind of standing in that gap if social service agencies are not going to have the capacity to take things on. So I feel like PATH becomes even more important during this critical time. I think winter's going to be brutal. So I would say fund them at the original amount.
Okay. Carla,
I concur with that. I think especially our experience with breastfeeding counseling. I know it's not the same thing, but we did breastfeeding support and we got a lot more response when we were texting than when we were phone calling.
Mhm.
So texting is the way younger folks are going.
Mhm.
Susan, any comments?
No, other than I support it. They've wanted to be able to text for years, and this is definitely the time that they.
Mhm.
Yeah, I mean, I agree with everybody's comments too, that, while they listened to us and came back with something, I would like to see them be able to offer the program that they proposed as opposed to a pared down one. And the other thing is, with all these, I think with the PATH and the texting, it may take some pressure off the crisis response as well. I think, Corey, your point too of it provides that support to the other providers. So I think at this point, we're all sort of looking at funding them at the original requested amount.
Mhm.
Okay. Any other discussion on that? So next one is the youth substance abuse prevention education. Anybody want to jump in on that one?
Well, I'll jump in. It gives me no comfort to suggest that this may be one place where we have to this year just not fund. If we're looking at the embedded schools and the support that is providing to our families, to our students and their families, we are getting a little bit more mileage out of the school program because we're responding to a whole number of stressors, and one may be substance abuse. But if we're unable to fund all of these, I guess I'm much more inclined to look at the school programs rather than the substance abuse, albeit that I have the highest respect for Project Oz, and it gives me very little comfort and joy to suggest this, but I think looking at the rest of the list, there are some things that we just have to have in place. And this is one I regret I don't think we can handle this year.
Any other comments? Susan?
I left this one blank on my little worksheet to come back to based on how much money might be available.
I would agree with that. I would agree with that, that if I cannot argue with Judy's comment, although clearly this doesn't just do substance abuse, it teaches kids coping skills, and it is a prevention, and again, in order for us to have a full continuum of behavioral health services, you have to have the prevention side of it. So I'm sad about that, but I also know we do not have enough money to cover everything. So I think we consider this as something to have to reduce significantly or whatever and come back to it.
Carla, you got any comments on it?
No, I agree. I hate to see prevention go away, but given what's going on, if we just do it for 1 year, that might make it a little easier for all of us to say yes to.
And if I might, I would be in line saying prevention. It's part of our mission as a health department. But we can, I think, build the case. It's not as substantial, but the embedded school program has the capability of providing some preventative services as well, preventing kids from becoming more stressed out or more anxious by having someone that is skilled to work with them. So it's not like we're letting prevention go totally.
Yeah, I mean, I think I am in agreement with what's been said. What I suggest is that we put a 0 there now with the understanding that this is a placeholder and to see what we can come up with. I don't know what they can do with, I know it's a sort of a package program, what they can do with how much money, and, so we'll see if we can find something left, and maybe we could ask them that question. The other thing is this program is reserved funding for a very long time from us.
Mm-hmm.
When we talk about sustainability, I think this is something also to think about is, are there other funds available to them? Could they be seeking other funds to try to cover? I know we don't cover the entire cost, but
we only cover half.
Going about it. So, this year may create a situation which we kind of say, okay, but the message might be, show us that you've exhausted the possibility of finding other funding for it. So, Judy, did you have a comment?
Nope. Not now. Thank you.
All right. The next one is suicide NAMI. They've offered to cut, let's see, is that one where there's a slight nope? Yeah.
I think, yeah,
Nope, it's,
I think that this one needs to be fully funded.
I totally agree.
Same here, especially now.
Mm-hmm. Yes.
yeah. Okay. So we'll just put that in at its requested amount. Okay. do we
Now we
want
just
to?
hope the schools,
discuss
now we
that?
just hope the schools will make sure that they work that into their insane schedules. That's always going to be the challenge this year of, since she does it in every high school in the county, can every school on their crazy remote / hybrid / in-person schedules, make sure they get it worked in.
Well, that raises a question in my mind, and I think it's been one where the programs are sort of designed to be delivered with regular school programming. And, you know, so maybe we need to kind of put that as I mean, the proposal, as I recall, and having not read it today again, was more or less to deliver the services the same level that they have in the past. Is that what everybody else's understanding is?
No, I think they redesigned it so it can be remote if it needs to be. I think like they did with the other program, they've tried to adapt to the current conditions. My comment was not meant to say it won't happen. My comment was meant that since it's a one-time only, different than Too Good for Drugs, which occurs, you know, for a series of weeks. I think the schools can make the one-time only happen. I'm just saying, I hope the schools do realize that they agree with us that it's a priority and that they should make sure it lives.
And their request for this year of 70,000 does include additional staffing. A halftime, was it? Or because they'd been funded at 50 last year, but didn't they add staff to this?
I don't think so, Judy, but I'm going to pull their budget up real
Yeah,
quick.
because why was it 50 last year and 70? I'm not recalling that.
That's a good point. I mean, maybe we ought to be looking at savings. If it's going to be difficult to do it, then maybe an expansion of the program is not appropriate for this year.
I don't think it's going, I should not have even said anything. I don't think it's not going to happen. I'm just saying, I hope the schools value it, that, you know, I hope they agree with us that suicide prevention is even more important this year than probably it's ever been. I think that they will. It is a one-time only time commitment on the school's part, and it's only at the high school level. So I think that they will. I think it won't. I'm just saying, I just hope the schools understand how significant it is.
And Corey, you know, though, do you recall somewhere, I don't think I made it up.
I'm looking at the proposal right now. I agree that they talked about adding some
So
support.
I'm looking at their budget right now. So it's the prevention specialist is paying her salary at 100%, and then it's paying her supervisor at 10%. So they're not, and both of those positions are already in place. So it's not adding any additional support that already exists.
Are the percentages higher? Because why has it gone from 50 to 70?
I would have to look to see the complete reason why it's 50 to 70, but I do know that the program cost more than $50,000 last year, but Project Oz, with like they ate, like not ate, it's not the correct word, but Project Oz absorbed the extra costs. I think it was like $8,000 to $10,000 that they absorbed that extra cost for that prevention specialist. And then, so I think that's probably like the 8,000 to 9,000, Judy. And then adding 10% of the prevention manager per time on there was almost 6,000. So I think it's a lot, that increase is mainly in not absorbing, Project Oz not absorbing the full cost of the prevention specialist and the prevention manager, the 10% of the prevention manager.
I will also say that they have, I'm reading from them how they adapted for this condition. It says if a school is in person, if they're allowing in-person services, the prevention specialist will teach full lessons in the classroom following safety guidelines. If they're not allowing outside guests, or if schools are operating remotely, they will have multiple options for virtual learning. If scheduling allows, program coordinator will teach live lessons via Zoom in real time during the normally scheduled class periods. Some schools have shortened their class periods due to schedule changes. And so they've also recorded 20-minute video lessons that will be delivered by a prevention specialist that can be viewed by students at their own pace at home. And they have accompanying activity ideas, self-reflection questions. So they have covered all bases. So I think we can guarantee that each district will be able to get this to their students, however is going to work, given whatever condition of learning they are in at that point in time. So I think we can pretty much guarantee it. And if you remember, this is in every high school in the county. So it is the coverage is pretty amazing for that amount of money.
Well, and this may bring a question that we'll address at the contract level, but, you know, it might be also something that rather than following the normal, just payout and whatever, is there a way to track whether, and due to no fault of their own, if the schools aren't available for them, or, you know, there's a lot of moving targets there for them to get it fully delivered, and they're doing their best. I appreciate that, but whether we can look at how we pay the grant
Right.
to track whether or not they're able to do it, and then find maybe savings that could be, I don't know.
No, it's possible that they may not be able to expend the $70,000 because of some of those limitations.
So, and I am misspeaking. It's offered in one grade level at each school at either junior high or high school. So the districts get to decide. So it's always either junior high or high school. And it does cover 2,240 students in McLean County are served. So, and again, they do have a variety of ways to ensure that the students have access to this presentation.
When it comes to ensuring that, you know, they do deliver, which I trust them to deliver, but if when we do the contract, maybe is it by school and then pay per school, and once that school has done that, then do it that way as an option, and that way, you know, we'll know for sure.
Real quick, as far as like the by school, Project Oz, well, for this program, since the Board of Health would be the only funder, they don't have to like divide up the schools between different funders. But the thing that I would caution against too is like sometimes like the schools pull out. So they still have to pay the full salary of this person, and they're not getting that money from anywhere else. But if one of the schools says you're not allowed to do the program here, I don't know how that would reflect with Project Oz still having the same amount to pay out. That makes sense.
Yeah, like would they reduce that staff person now to 3/4 or something and have less cost? Yeah, is that what you're meaning?
Correct. That the cost to them, like if a school pulls out, the cost to them is not going to Project Oz isn't going to decrease.
I hear you.
If we're saying you have to serve X schools, and then when those schools pulls out, or we're paying you less, then yeah, what do they do with that staff person or that extra cost, unless they just absorb it within the agency?
Well, and that unfortunately, we're talking about the services. I don't think any of us relish being a party to people losing their jobs right now, especially. But that unfortunately is not something we'll be able to have any control over in terms of the decisions they make. That's not for us to make, the staffing.
Again,
Sorry.
No, you go ahead, Amy. Sorry.
Hands were up. And the last thing too is you guys talked about indirect costs last time, and looking at those. And if you notice on the spreadsheet for indirect costs, they did use the full 10,000 for ending the silence too. So that helps account for that extra 20,000 between last year and this year.
Okay. Yeah.
Any other comments on this?
I just say as long as we allocate the total amount to begin with, and then do make sure that they just have to keep they just are having to keep data on how it's being delivered. I think they have a good enough relationships with the schools that, and given that they've got 3 different ways to deliver the content, I would certainly think each district could make sure that it's delivered. Because again, it could even be that it is sent to students in their home, and the students are expected to view it on their asynchronous day. In other words, a day that's not being taught by a teacher, but the students are supposed to be online learning. So I think that's always an option.
Well, I suggest at this point that maybe we leave it in and it's fully with an asterisk maybe by it, because I'm thinking that maybe the percentage of the supervisor could be something we'd look at, or again, I think with any of these, because in my mind, in a sense, indirect costs should pay a portion that the supervisory role could be arguably part of indirect costs, that you have people who have to supervise and provide. We haven't defined it necessarily, but maybe there's a way to find some savings in that program.
And I will just say, Mike, the supervisory stuff right now in a lot of these programs that have had to go remote or think, the scheduling piece has become amazing. The communication becomes huge in terms of working with every single district in the entire county, every single high school or junior high in the county to set up the schedule. So that's a lot of what I'm sure that supervisory time is going to, is just building a schedule that gets this into every single entity.
Yeah, so to move on, it sounds like we're maybe looking at this as some way we could track it or something, but basically funding it at the requested level at this point, kind of as we move forward. Is that, everybody agree for right now?
For this moment.
Okay, so our next one is mobile crisis. They didn't offer us any sort of reduction. I see that they are, I think that's pretty close to what they asked for last year, isn't it? Is it?
Yes, it is.
An increase, Amy?
Are we talking about mobile crisis unit? I got lost on the list.
Yeah, number 7. We're at number 7.
Okay, yeah, the mobile crisis unit, I'm sorry, let me move the screen a little bit. They asked for 383, 253 last year. So they're asking for around $1,000 more this year.
Oh,
And
comment.
I would throw out that what we have heard consistently is that the acuity of the situations they're dealing with is much higher than it's ever been. So not only are they dealing with much more serious conditions that they're dealing with, but they're also having fewer places where if people do need hospitalization, where they can put them, because so many of the hospitals where they would typically put them have had to restrict the number of beds because of distancing, COVID-related distancing procedures. And so they have to work so much harder to find places for people when they do need to be placed somewhere. So their work has become much more laborious.
Judy.
No, I'm following Corey, and I believe she's going to suggest we fund them at the amount they've requested. If that's the case, I'm fully supportive of that.
Logging in.
Susan or Carla, any comments?
I just want to also add that I'm also aware that Megan Mosier, who obviously heads that up, that she has also been very stretched very thin in that agency, or entities are also asking her to give them ideas about how to deal with stress of employees in their particular entity, or just how to deal with mental health crises. So she's also doing a lot of just, here and there. She's doing presentations and putting together materials, and so she's also in her, she's wearing many hats right now, which she always does, but even more so, I think.
I think I'm sensing consensus around keeping that the same level. I'm going to throw something out there for just to think about as we try to find some money here. We've got one agency, and each time they submit something, they're requesting 10% for indirect costs.
Whatever it is right now, log on.
Could we consider whether or not there's some economies of scale for them that, you know, some of the benefits person who handles that maybe we could look at reducing the costs to multiple
For the next 2 weeks. Tomorrow you're doing everything.
requests. And that maybe we could find some savings
In 1 minute.
in their costs, so. All right, Amy, you got your dog taken care of?
I am sorry. I thought I was on mute. I'm trying to get medicine and yeah, I don't get embarrassed very easily, but yep.
Amy, welcome to parenting in the year of COVID. No
Yeah, working
worries. No worries.
remotely. Yep, I am so sorry, guys.
Anna, would you please repeat what you just said? Because to me, it was cutting out on some of the things when the dog was barking, so.
Okay, what I was suggesting is that, you know, one of the things we've talked about, finding some savings is looking at indirect costs. And since we have the Center for Human Services having multiple applications, and in the embedded schools, I see they didn't include that, but in these two, they've included the 10% per each program. And my thinking is, are some of those costs, you know, fixed in a way that, you know, a human resource person or the office space is the office space is the office space that, you know, we might say, well, if in order to make this work, maybe there could be a cut in that line to find some savings. So that's my only thought. I agree with what everybody said in terms of the program, just maybe to keep in mind if we get to that point that maybe we look at maybe cutting that to 8% or something, just to knowing that they're getting it in two different programs. So shall we just move on then to psychiatric services, number 8? Who wants to start?
I have a question probably for Amy. Under psychiatric services, of course, there's been a significant increase over last year. Amy, do you know, at one point in time, can you remember a few years ago, Mark Center had to contract with a psychiatrist, I think it was Telepsych, for their clients who needed some psychiatric services. But CHS stepped up and was funded to provide that service. Does this include, under adult services psychiatric, are these adults both experiencing a behavioral health crisis and who also may be developmentally disabled, or are they serving that population separately?
So for the first point that you mentioned, Judy, I don't ever recall a time that Mark First or the 377 board was providing any type of funding, like outside of insurance, was providing any type of funding to psychiatric services. And so I know what you're talking about in the reports. They include in the reports some of those programs that they're providing services to. And so the Mark First individuals, the Mark First residents that see the CELA residents that see the CHS psychiatrist, of course, they have the intellectual or developmental disability, and they also have severe mental illness. So they have comorbid disorder. And they do still see some of those individuals. I don't remember exactly how many, between like 20 to 25, I believe. That's an old estimate. They still do see those individuals, but there isn't any separate funding for them. It still comes out of the current pot between like the Board of Health and fee for services. I hope that answers your question.
So it is in there. Okay. So the short-term counseling and dealing with medications, et cetera, under adult here, it's all adults who are served by CHS, whether they be those with an intellectual disability or not.
Yes, yep,
Okay.
correct.
Thank you.
I
And can
said
you
this,
refresh us again on the increase from the 400,000 to the 551,000 request? What was the now
I
there?
think that is so they use less of their reserves, is how I saw the budget.
That they are using less of their reserves? Is that
That's what I read into the application. That may not be right, but, and I know, Susan, you're up next after Judy.
are they using any reserves? Do we know?
I think the budget reflects that they are. I'd have to pull it back up.
Yeah,
I can pull up the budget real quick while Susan or whoever's talking next and let you guys know.
Okay.
until I see, I said this last time, a financial statement from them, I would not support this increase. And so this has been a very long history on this kind of thing. So that's just kind of my take on that. I would like to see their full financial statement before I would increase this.
Should,
We
can we-
know, I think you can budget for use of reserves. I think we've done it in our own budget. We budget those things and then we don't end up using them. So budgeting for it, I agree with Susan. I'd like to see the actual use of that. And I guess I can't support the increase either.
and is that because you have not seen the financial accounting of it?
In part that, and in part, I don't see anything that indicates any interest in increasing the numbers of people being seen. And, you know, I think we all have to accept what we have here is more or less a capacity grant with this organization. I don't know how many clients I know in reports we used to see in the past who they saw who did not have insurance. And it wasn't very many. Now, maybe that will increase since people have lost their jobs and their health insurance coverage. But I just, that's kind of my feeling about it. And yes, I don't think we've seen the actual expenditure of those reserves.
Well, and what is that percentage of their reserves they used last year to request 400,000 versus have they eliminated all reserve? Have they cut it by a certain percentage? That's what I don't know and would like to know. Because we have to, this is a service that is going to be very necessary for the long term and what they used to call the chronically mentally ill. We have to find a way to make sure they receive the care and services that they need.
Agree. Judy, are you then supportive of the increase? Is that your position?
Right now, I would. I really would like to have the conversation. I think we've sort of all been jumping around, and that is what percentage of the reserves were in last year and what percentage have they said they have to cut and resulted in the $551,000 expenditure. Because I appreciate we have to. We use reserve funding in the health department. I know that they have to, but I'm interested in that kind of a balance. If they're not using any reserve and they have it, that makes a big difference for me in terms of approving this initial amount, the amount requested.
Judy, to answer your question real quick about in the budget, they have $80,000 for 21. They budgeted $80,000 of their money in reserves for the 21 budget.
And what did they budget the previous year? 20.
For their
Reserve.
I don't remember what they budgeted last year, but I do remember their end of year report was they used 400,000 last year
Yeah.
out of reserves.
They used 400,000 last year, 20?
At the end of according to their annual report,
Uh-huh.
end of the year for the total cost of the program versus how much in fee for services and what was provided in funding, there was about a $400,000 deficit that they used reserves to pay for.
Mhm. And so, yeah, could wonder if they're going to now cut that reserve. That's what I don't know. I'm afraid I'm kind of iffy on this one. We have to find a way to provide the support. I think maybe to Susan's point, it would help our comfort level that these are the best use of these very limited tax dollars if we understood more about their reserve and their policy about utilizing that. So I don't know where we go.
I'm just wondering, do we have to be consistent if we're asking one entity to show their financials? Is that something we should be doing across the board? Are we being, do we have to demonstrate why this entity is, we're doing it, asking for maybe information above and beyond what we are asking other entities? Do we need to consider that? And I really am asking, not telling.
Well, I guess the reason I would identify them as being unique in the amount of money they get from us. You know, I mean, they get almost a third of what we have available. So, and I
Yeah,
noticed the mobile crisis, they did not show budgeting any reserves to pay for that program. So I'm not quite sure how the end of the year report shows a $400,000 use. And then the budget did, I don't know that the 2020 budget showed 400,000 of the cost being covered by reserves. So
I have a copy of the annual report, which just shows like the numbers pulled up, but according to last year's final numbers, the program cost a total of $1.1 million. And between the health department grant, Scott Commission grant, United Way grant, and fee for service, according to them, they received $684,000. So it was a difference between 1.1 to 1.1 for expenses. And according to their report, 684,000 was received.
Kind of makes up the difference in what we funded last year. I wonder, I'm assuming maybe they're anticipating less funding from those other sources, and that's the reason they've asked us for some additional dollars. I mean,
Well, they're not receiving anything from United Way for 2020, according to their budget. And they're receiving 100,000 from Scott Commission, which is a little bit up from last year.
Mm-hmm.
So Judy, according to their budget, you're correct that for this or for 2020, they're reporting that they're going to receive 100,000 from Scott Commission, and then that would be the only other funding source besides the Board of Health.
that makes about 650,000 if we were to fund them at their request. And so that would suggest that maybe they're using almost another $400,000 of reserves. Again,
it's not clear because they show a budget of 80,000 for reserves. So,
but then where's the rest of the money? If they're going to get 100,000 from John and Scott, and we fund 550, that's only 650. The cost of the program is $1 million. So I guess I'm wondering if the additional dollars are not from reserve, but they're saying in the proposal they're not going to use that much. Where's the other money coming from?
Well, do they get some fee for service? I mean, they get some fee for service dollars.
$300,000 worth, you think 300 or 400,000? Again, I don't know, folks.
And
We're
I
raising
guess
questions here.
we have a
I
budget for the program. And if you look at it, and I guess we can look at other documents, but from my perspective, I would say this is the budget to have the psychiatric program that they've provided us. And it looks like it's about a $700,000 budget. So, and they say it cost them 1.1 million. So where is the difference coming from? And if
Exactly.
you
We're,
gave us, they're showing what revenues they have from us and from other sources. And I guess I didn't go in and total these. If you look at the budget they presented, the other lines all add up to the total. Let's see, there's a final page, isn't there?
Yeah, it's coming out on their, do you want me to share their budget? And they're saying $370,000 is their estimated fee for services for 2021.
some thousand is. Because,
And
you
so
know,
share the final, the last screen of their, so this is a summary of their
Yeah,
budget on the
summary.
screen.
And so the summary shows total costs.
I think I have the wrong program up. I have the wrong program up. Today is not my day, evidently.
So there's a total project cost of 802,276. And they're showing 384 coming, well, I'm sorry, I did the same thing, Amy.
Okay, there we go. So they're saying total program cost of 1.1.
I was looking at the wrong. But
Yeah,
they're showing the budget
my-
that, so are we all still here? Yeah, there you go, Amy.
and this is just their summary. So if you needed to see like specifics, I can go to that page. But this is the first column is MCHD. So this is the line items that they're requesting funding for from the Board of Health. And then the non-MCHD, those are expenses that would be supported by a different funding source, either Scott Commission or fee for service or their reservations. Reserves, not reservations, or reserves.
but it did, okay. And we don't break out of that 550. We only know that they're going to get 100,000 from Scott, but we don't know how much is reserve and how much is fee for service, correct?
No,
No,
we
they broke it out and there are their budget pages.
Yep, so on this tab on non-MCHD, you can see like up here, fee for service, they're saying that they think they'll get 370,000. They're predicting to use 80,000 of the reserves, 100,000 from Scott Commission with a total of 550,000. So that would be funding money, would be money from those sources besides the Board of Health, sorry.
Mm-hmm. Right.
Amy, would it be terribly difficult to pull up the same budget from last year's request?
Um,
If you can give me a second, I'm sure I can find it.
And while she's doing that, I'm going to mention, so altogether for that total amount from all funding sources, they're talking about covering 600 individuals. And they're saying that our portion pays for 300. And I'm trying to remember how that compares to last year, because I remember we went back and forth a long time about how many we wanted them to serve for the money we gave them last year. And do you remember what that number was last year that we wanted them, that we kind of held them to? Because this year they're saying for our dollars, it would be 300 individuals.
Yeah, we had them doing new clients. And wasn't their total number less than 600 in the past?
The number that they agreed to not go below for the total funding last year was 600. And Corey, I think the number that you're referring to is like what percentage, if you look at the whole number, the Board of Health, what percentage was 250 clients?
Was last year, was 250?
Yeah, well, yeah, this year, 2020, yep,
Okay, and this year they're saying 300 for our dollars.
or 21, yeah. Basically, I mean, they're saying 50% is coming from the Board of Health and 50% from,
For a total of 600 individuals. So I think we need to pay attention to that too, because I think we, certainly don't want to be, this is not the time for these individuals to being kicked off of.
And
Roll.
aren't they saying they're going to serve more individuals? Correct, Amy? Because
No,
wasn't less than 600 last year, and that was why we were negotiating adding.
it's still staying at 600. So they haven't, I think, they haven't gotten below the 600.
Okay, thank
I've been in this position, but they're still agreeing to not go below 600.
Okay. Mhm. Maybe that, okay, thank you. Wow.
Yeah, it's a problem. Yes, Susan.
Yeah, they want more money for the same amount of individuals, basically. And like I said, I still want to see their whole financial statement. And I don't think that we're looking at them differently only because of the history of this whole thing in the long run with financial statements and that kind of thing. So I think that it's justified in asking for that for this one particular agency because we have a history of that kind of thing.
Judy.
I have a comment and a question. I think I agree with the history. However, I think that could get us into some issues and some debate. They're asking for us to fund half of their project. That I think is what we should be thinking about, the history. And by saying we want to see their financial statement, are we then, what in that financial statement, are we interested in the percentage of billable dollars that you received the previous year and what you anticipate in 21, what you used in reserves the previous year, what you're going to use in reserves, and are there any other sources like the John M. Scott? To look at all of it, I guess I'm not interested. I'm just interested in their funding sources for this.
And I do, that was
The-
budget. You guys want to see that? So.
Counts for half of what we have available, just a little bit less than half than what we have available, certainly does justify some in-depth questioning. I would suggest we keep the history out of it.
And appreciate that
true,
comment,
but we-
Judy. I think the reality is we can't fund them at 551 and I mean, we got to find the money someplace. And I understand what you're saying. And I've kind of believed that this is a unique organization. They serve, they have a psychiatrist, which is a rare animal in this town. And they, and as I said, I think it's more or less a capacity grant that we make. While they say we serve 300 with your money, we've never been able to figure out how to track our money and tie it to client services. And, I think sometimes that's what you do to ensure that the program's available. But truth is, unless we severely cut other programs or there's money from some other source available, we don't have the money to support it at the 550.
Mm-hmm.
Go ahead, Susan.
Part of it, yes, I know we have history and sometimes we want to forget history, but
No.
we have to remember that these are taxpayer dollars that we are to be the funder of last resort. And so I think that is where I'm concerned here. I believe that we have people that have this need and that kind of thing, but I have to, we're the funder of last resort. And so, yeah, but I can't see, yeah, we'd start cutting a lot of other things if we end up funding them at 550. And I can't see us going into our reserves to fund other things for that until we have a better picture of some things.
Judy,
Just a comment, and Susan, I agree, with the exception that I'm not suggesting that we forget the history, because it has been a very significant part of our evaluation of these services. But I'm suggesting that that history is part of what's precipitating our wanting to look at this. However, the fact that it is such a significant, much more than any other request, portion of our budget, I think that justifies alone asking the questions. The history could become a little subjective, and I don't want to get us off track of really looking at the figures. And that's why I'm suggesting the history be set aside, certainly not forgotten.
Amy,
and
you
could
had the
go ahead.
budget last year, and Corey, go ahead.
just going to say, we just have to be very, very clear what we're wanting from them. Because I'm still not exactly clear what exactly you need to see in order to feel like your questions have been answered. Because they've already told us what they're going to take out of reserves. So what else, what additional information are you seeking from them in terms of financials?
Okay, Amy, what are we looking at side by side here? And is this, because we did some negotiating last year, but was this the budget that was the working budget for the program for 2020?
Okay, so this is the budget that they turned in for 2020. And then what was it that, you can't really see anything right now, but what was it that you wanted to see on 2020's budget compared to 21's?
Which one is which right now?
So,
got-
Figures, either one.
yeah, this one that I just highlighted is 2020. What figure, do you want to see the summary from 2020? Do you want me to take 2021's down? What is it that you guys want to see?
That over so we can see the numbers that go with those lines. We can't see the numbers there.
Okay, so this is 2020's budget.
Okay.
This page is non-MCHD funds.
Very clearly, you can see $338,000 in reserves.
Mm-hmm. So they've reduced.
That's what they budgeted for 20, that's what they budgeted to use in reserves for this year for 2020.
But yet they're saying they are only going to they're going to reduce that significantly for the next year.
Yes, for 21. Yeah, for 21, they're saying they want to reduce it from 338 to 80,000.
And yeah, as Susan said, we're the funder of last resort. If they are, and I have no idea how many dollars they have in reserve and what the anticipated use for that might be. But if they're sitting on additional dollars that could be put into this, I agree. It's incumbent on us to talk about that, rather than say that we either have to cut someone else or use these valuable tax dollars, when in fact a tax supported entity may have the capacity to at least share some of that with us and up their use of reserves. And that's a judgment call partially, and I don't have an answer.
And I do want to bring up real quickly too, that during my last site visit with them, which was in August, that they also talked about because of COVID, the pandemic, that they were predicting, and I haven't followed up with them, but they were predicting having to use their reserves for other programs within MCCHS, because there was such a hit on all agencies on fee-for-services, because so many people weren't reaching out for services during especially the early days of the pandemic. So I think that might be some of the reason too why they're asking less for, or saying they're going to use less in reserves, is because there's the chance, or at least during that time, they were predicting they're going to have to use reserves for other programs other than just psychiatric.
And that's probably very true. But every agency that has any reserves, including our own, is going to be faced with that possibility.
And Amy, just so we're clear, the 1.198 million is that pretty much the same as the total for this year?
Okay, so this is 2020. I'm gonna bring up 2021's. Make it large. So this is 2021, and let me look.
So it anticipates less fee for service. Yeah,
Well, a little bit less than last year.
showing about slightly
A little less.
the same. Yeah,
Yeah, it looks like close to 90,000 less than the overall budget for this year, 21 versus 20.
okay. And they've shifted, I think, some of the personnel costs our direction. So, okay.
Mhm.
Do we know, Amy, if they had significantly greater costs in this particular service for personal protective equipment and things like that, and having to modify their physical structure to create more safety and social distancing options? And did
Yeah.
they do funding for that? Or again, did they have to factor all that in? Because let's face it, I will tell you, every entity I know that's had to do that, it is very costly to install, plastic sheetings or, dividers and all the personal protective equipment, et cetera.
So Corey, I don't know like the exact details, but that's a really good question. I don't know the exact details, but we, like the health department, we did work with them on some of their PPE requests. And so because it was really hard for them for all agencies to find PPE. And I know that they had, since especially psychiatry, I mean, that's ultimately, it's a doctor's office. And so not all of their patients could be seen virtually because they didn't have that capability, and some still had to come in person. And so, and I don't know the numbers, but I know that they purchased some of it on their own because they had talked about even getting extra thermometers for all of their staff to, but this was more like embedded school projects to have thermometers to make sure that, like, to be able to screen themselves and individuals that they were being able to see from a distance. So I know some of the costs were on their own, and then I know some of the costs too, like the health department helped with some of the PPE, but I don't have the exact logistics of that at all.
So to move us along here, I'm going to suggest, because the budget is what they presented us. So if they had more costs, would have been reflected in the budget. I'm going to propose sort of a split the baby, that we reduce their budget by 80,000. Which means if they spent 380,000 out of their reserves, and I think the budget is showing us that basically what this is a use of our money versus their reserves, that they're going to have to still use some reserves because we can't fund them at the level they're asking. So I thought 80 adds 100 makes the reserves 160,000, which is about half of what they used last year. So just throwing it out for discussion.
And I think that's probably one of the solutions. Will that raise again, Amy, the issue we found ourselves in last year, and that was with reductions. Then they say we're going to have to we can serve this many less individuals, and if the commitment is 600 individuals, and they say we can't serve those, are we going to get back into that same discussion we've had before? And I don't know how we avoid it.
I don't know how we avoid it or what we do with it. I think we have to say you honestly submitted this proposal that says you're going to serve this many people, and it would require you to use your reserves, yes, to do that.
So we're going to hold we want the 600 figure to be on. Okay.
Yes.
All right.
So Amy, when you do that, of course, the indirect costs come down, but I guess we'll just use that as a total. So then
That brings us to about 471,000.
May I make a suggestion
Mm-hmm.
to throw something else out there?
Yeah.
What if we skip this one at the moment and then talk about the embedded schools, since that's all that we have left, and maybe make a decision on embedded schools and then see what we have left, or at least allocate 400 from this current funding, and then do the embedded schools and then see what's left to see if we want to then put maybe something back in to that to increase that number.
Yeah, I mean, we can do it either way. I'd be curious to see what we have with what we've done, which is probably not enough, nearly enough. I mean, I think what you're saying, Susan, is we need to probably come up with a total for embedded schools. And then how we think it should be distributed. Is everybody kind of on that same thought?
Yeah.
I am, but I've given that a lot of thought, and I'm wondering if we should just should just pick a dollar amount and tell Center for Human Services that that's the dollar amount, and then let them, because of the uniqueness of this school year and how the schools are going in and out of hybrid, remote, in person, and let them, like whatever amount we give them, we say we want you to serve 5 entities or whatever we decide, 4 entities at 20,000, 5 entities, whatever. And then say, but let them pick the entities, because they have to work out the scheduling arrangements, and they have to make sure that the schools that they are working with are committed to allowing them to really be, fully effective in their setting. And this is such a weird year. I think they should decide that rather than us this year.
But
Carly, was that wave to say something? No? Okay.
no,
So
I
Corey,
don't.
on Center for Humans, the psych program or the embedded schools? I wasn't clear which one you were suggesting, just come up with that.
Embedded schools, that we just pick a dollar amount, like we decide, are we going to pay for, we know it's going to be we know we're paying $20,000 per entity. And obviously an entity in some cases is 2 schools. So whatever that collective entity is, if we just decide how many entities at $20,000 we want to fund, and then let Center for Human Services, of the list they've given us, they prioritize, because they're going to know which schools are going to be more able to fully use the services. Because again, because of the in and out of hybrid, remote, in person, it's just difficult. So I say let them do it. They know a whole lot more about it than we do.
So what you're saying is $148,000 be given to CHS and have them prioritize which schools are served?
Yes. Because I think we would agree that as we looked at this, every entity is unless we want to say for sure we want them to do Olympia, because Olympia is kind of a, the only rural school. But I don't even think we need to do that. I'm just saying we give Center for Human Services, we say we want you to do 4 entities, 5 entities, whatever our number is. And then they pick the entities from this list, because they've already prioritized the list essentially.
Yeah, Amy, go ahead.
Can I just quickly state too that I understand what Corey is saying, but just from having site visits and discussions between CHS and the schools, that I think that would put a hardship on CHS feeling comfortable or being able to say to like the schools that they bidded with and saying, no, we didn't, like them saying like, we didn't choose you, we got the funding and we're not choosing you, we're choosing these schools. And so I don't know how that would go with CHS being in the position to make those decisions, like, because they still have a relationship with those schools because they see kids in those schools that have Medicaid. And so I don't know what type of position that would put them in their relationships to say to the schools that we're not going to go with you, we chose someone else.
I would suggest that they work with the schools to help make those decisions. And to me, one of the factors about how they decide which schools they ultimately serve is how much of a true partnership can they have in particular entities. Like, are they going to be fully embraced so that they are fully able to be functioning members of the school team and getting, so that you're getting maximum outcomes, maximal communication, maximal, just so. And so I'm saying that they wouldn't just say to the schools, this is who we're working with. They would say, of these 5, we want to be in the schools that are going to most embrace us and most support us and most support, making this work maximally. And then they together make that decision. But I'm just saying, because some schools may be at less of a capacity to open themselves up to services based on crazy scheduling, it's maybe better for them to sort that out than us. So I'm saying they would do that collaboratively. I'm not saying they would necessarily just pronounce this is who we're serving. I'm hoping, and as partners, they would work that out collaboratively.
Okay, Judy, and then Susan.
Okay, yeah. What's being described here almost sounds like what we have discussed is perhaps looking at for next year, and that's putting ROE as a subcontractor to kind of sort this out. What we'd be doing to CHS right now is putting them in a position of being like a subcontractor, one that they didn't have that responsibility, and I'm not sure or clear for a lot of reasons they would be able to fulfill it. So what's being suggested, I think, has merit, and that's what we thought we would like to talk to ROE. Right now, to do that, I think would be problematic. So,
Susan?
Yeah, if you look at the ones that we have funded in the past, which are Bloomington High School, Kingsley, Oakdale, Olympia, and Parkside, Fox Creek, those relationships exist. And so I think that what Corey's saying, it possibly even on any additional schools, if we go to an additional school, would we have that kind of partnership? And would they be able to develop that partnership? But that partnership already exists today in schools that we fund. And we also know that it also would exist at Bloomington Junior High because of conversations we've had with Bloomington. So to me, those should be funded, that we funded in the past to keep that relationship going, whether they're hybrid or not. Even CHS said last year they managed to make some of those work when the kids were all remote. And so I think that they can manage to make that work, whether they're remote or hybrid or in person. So those are the ones to me that I think we should look at first and say, are we going to fund them again? And then see how much money we have left to see what direction we want to go on any additional schools.
I'm good with that.
Yeah, that makes sense to me. And the other thing I thought of with this is and of course, we have one for Olympia School District, and then we have these separate applications for each individual school. And so within the school district itself, are there some economies that they could reach that some schools are experiencing more than others at different times? So without having a regular school schedule set up where you have people every day coming to school, can they move people around a bit between schools more than they might have in the past? I don't know if that makes sense, but maybe stretch the resource a little bit if kids are at home, but there's only, which days are there, and share more maybe between schools if that's possible.
I think that makes sense.
But Susan, so what you propose that, and Amy, why don't you put in something on your spreadsheet of those that we are currently in so we can kind of see them and put the dollars out there for those.
And that kind of relates back to the funding for the psychiatric, because then when we put these numbers in as to where we end up, And we have to make a decision as to which we want to prioritize, schools or adult psychiatry.
And I was having a lot of technical difficulties, so I had to go out and I couldn't even see the screen.
Oh my gosh, okay.
But now,
Well, welcome
it seems
back.
like- yeah, now evidently I can talk, so we're good.
All right, do you have anything to say now that you're back with us?
No, I just agree with what Susan's saying. Start with the 5 or 6 schools that we're currently funding. Uh-oh, did you guys lose your screen?
No,
We need to keep the spreadsheet, though. We lost that, Amy. There we go.
Oh, okay, thanks. I wasn't sure if I was having gremlins or
and so.
Yeah, nope, I stopped sharing it for a second because whatever's on my screen is shared. And Corey, can you check the schools that I put the money on and make sure that the ones that are blank, that those are the new ones? I'm trying to go off memory without taking this off.
Well, do we want to go with the Chestnut request for
Yeah.
Sugar Creek and Fairview? We should also be at 20, if that, that should
Right.
also.
But I think Bloomington Junior High, I think Susan included in that, even though we weren't there last year.
Right, we were in there in the past. So put the
Yes.
20,000 next to junior high. Okay, and then I think Chittix, Colleen, Evans, Cedar Ridge, Irving, and Sheridan, those are new proposals. But that's going off of my memory.
Kingsley, Oakdale, Sheridan, Irving, Evans, Cedar Ridge.
Yeah, I think those are all new proposals.
They were all be new.
What I have that we funded last year was Parkside, Fox Creek, Kingsley, Oakdale,
Mhm.
Fairview, Sugar Creek, although that was kind of a bust, Olympia,
Uh-huh.
and then
That's-
I'm leaving. And what's the other one you got there?
Bloomington High School, starting August
Yeah,
1st.
Wilmington High School. Yes. Okay.
Okay,
And
and then okay, they're correct then.
Yeah. And again, to be fair about why Unit 5, why Fairview and Sugar Creek were a bust is because we were introducing a new person into a system that was doing COVID, and it just didn't, so it was very hard for relationships to form.
Well, Amy,
So-
can you move the Fairview one down to the rest of the embedded school list? Can you just, it's kind of not visible because it's,
It's separated between mobile, yeah, the
Yeah,
mobile, yeah. Mhm.
Well, that's Chestnut. That was why that was separated out. So
so do we want to put 20 for that since we funded it last year, or are we holding that out?
If that's the criteria that we're going to look at what we funded last year at 20.
except that it did not, I think they only saw, what was it, Amy, like 5 kids or something? It was not a successful program.
Mhm.
And again,
Well, and
And they didn't tell us.
they said that they needed that 62. So to me, giving them 20 isn't going to get us anything on that one when they've said they needed that whole 62. So to me, that's a zero.
I still need to check with them. That therapist that was with them is now resigned. And so I haven't had a chance to check with them to see if they're seeing any of the kids anymore at those elementary schools, or if they've just pulled out at this point.
Well, we can put the zero in there then, as Susan suggested.
Yeah, I put that at 0 since they said they can't operate with any less, so.
And then that leaves us with 4 schools, 63, no.
5 schools.
No, actually 4. In terms of last year,
Oh, okay. Yep. I was counting the Bloomington Junior High School.
okay, we're putting in the junior high at 20. Mhm, okay, so that's 5. All righty.
No, so we got 4 slots and we have $33,000 left.
To be reduced.
No, that's what we have left in the bank. We have, if you look at that right?
That's
We had.
without CHS though, right? Is that without psychiatric?
No,
No,
that's in,
that's with psychiatric at 471,666. That was with taking it down 80,000 with Hannah's suggestion. There's 33,624.74 left. And then that's keeping NAMI at the full price and then not funding Project Youth Substance Use Prevention Education.
And not funding the Chestnut schools. Mhm.
Yes.
So.
I do want to make sure, just for the record, I do want to say the Chestnut school system, I want to be careful that we do understand that part of why that was not a successful launch there was because of a new staff member. First of all, not being able to find somebody for a while, so it launched late. Then difficulty forming a relationship when everybody was on remote and operating at very weird, during very weird conditions because nobody quite knew how to do remote in the spring. And then the person ended up resigning. So I don't want to disparage the services in general. I just want to say that particular one did not launch for many reasons.
right, and appreciate that, Corey, but I think when we asked for budget revisions, my reason for the zero is simply they said they can't provide the program for any less dollars.
I agree with you completely. I'm only saying that for the record. I just wanted to be clear on what I was saying. I totally agree with you. I don't understand why we would pay one entity $20,000 and another $60,000. That does not make sense to me.
Susan.
I would like to offer funding, since we have 33 left, funding Irving and Sheridan. They are in our target zip code with the low income. They're also a population that has probably been traumatized quite a bit. And we are really working on being sensitive to those kinds of things. And so I think that set of those two schools could benefit quite a bit. And with the community schools in Sheridan, I think that there could be a very good partnership with CHS to really work with those kids and get some early interventions and head off a lot of things in the future.
Yeah, the other thing you got there is you've got elementary, junior high, and high school in the same district. So that's a kind of nice progression. And I would add to that we would bring in Evans and Cedar Ridge. I think Cedar Ridge is a school that also has some high need kids, which would kind of put us over a bit, but we could find that $6,000 to make that work.
So then the only two we're leaving out would be Chittix, Colleen Hoos, and Fairview Sugar Creek, correct? Those two, 4 schools, but they were 2 proposals.
Yes.
Okay. Now, Amy, what can you review for us, starting up with Healthy Start, the amount that we've kind of drafted in? Healthy Start was going to be $77,250. Okay. 87,070, and that's the whole 7.
Healthy Start was at the revised request at 77,250.45.
Right.
Path, the crisis 211 call center, their original request at 87,916.81. And then not funding substance use prevention education at Project Oz. Funding NAMI Ending the Silence at the full cost of $71,123.76. You guys have a star next to that one. Mobile crisis at the full amount of $384,832. Right now we have psychiatric services at $471,666. And then Bloomington High School at $83,33, and that's because it will be That funding will be from August 1st, 2021 through December 31st, 2021. Bloomington Junior High School at 20,000. Evans Junior High and Cedar Ridge Elementary at 20,000. Irving Elementary and Sheridan Elementary at 20,000. Kingsley Junior High and Oakdale Elementary at 20,000. Olympia School District at 20,000. Parkside Junior High School and Fox Creek Elementary at 20,000. And so then that leaves negative 6,375.26 that would have to be taken from somewhere else.
Mm-hmm. Okay.
I have a question that I get lost in with the embedded schools. There are people, don't some of these agencies have people in the schools via, we said Medicaid is one source. And then I'm just surprised that Chestnut has so disappeared from it, because initially they were in multiple schools. Are they doing it just funding it with other dollars, or are they just not in the schools right now?
They're still in the schools. I don't fully understand what schools they're in McLean County. I know they're in schools in other counties, and that there is some direct funding between some schools and Chestnut, but I'm not sure if they're in all of the schools.
At one time, they had a presence as substance use only. I mean, that was their role, to be kind of consultants when there was a young person that schools identified as having a substance use issue or concern, and they were available. And we used to actually fund that as a separate entity for all of the schools. And then I think then they got different funding for that. So I'm guessing they still can be kind of on an almost like an on-call kind of a thing, but it comes through a different funding source for them. And it might be, is it DASA? Maybe, I'm not even sure. And then, but I mean, just to be clear too, Center for Human Services is in all schools in some ways. I mean, but there's the ones that we do not pay for, they are there more as they come in, see a kid and leave. They don't become embedded. They don't become consultants to the teachers. They don't become, they don't maybe do as much significant work with the families or whatever. They mostly just are called in to see a kid. But Center for Human Services is in many, many schools other than the ones we fund. And Project Oz has a presence in some schools too, not the prevention piece, but they have some outreach workers that actually are in some schools and see kids for counseling as well.
Susan.
What I know about Chestnut, I know that they're still in Ridgeview, and they may be in other schools because it has become sustainable for them, so that they do not need our funding, and because of the payer mix. And so I think that that's something that we need to actually look at, but not this year. But I think that when we start looking at next year on that kind of thing with the fee for service and things like that with Ridgeview, I know for a fact that they said that it was sustainable on its own. So they may be in some other schools somewhere else. I don't know where. But, and it's because they found that it possibly could be sustainable, so that they're not even asking for us, and we don't even know that they're in there. So we don't even know what kind of outcomes or any of this when it comes to looking at the whole mental health action plan to see if we're actually making an impact on youth in the communities. And so I think that kind of is something that we have to look at as a whole. Not just the Board of Health, but a lot of other entities working together on that. So, but I do know that they told me, I heard it was sustainable at Ridgeview on its own. So.
Great. Yeah, I was just thinking and we got the summary data about the school, I think school personnel there in terms of guidance counselors and whatever, but it'd be useful down the road to know how many of these other outside people they have also coming in and whatever. But yeah, I agree. and I think, you know, Corey had raised the issue of making these funds available as a block and not dividing them up by the schools. I guess personally, I think we're at the point now, I would rather see it directed to specific schools this year. I think we have some work to do with this. I think we're kind of upside down in how we do this. So, you know, maybe our committee can, after we get through this hurdle and we look to the next year, start to look at maybe forming a relationship either with the school districts or with REO. No, that's the band, right? ROE. To maybe do an intergov with them to give them some money and then distribute it into the schools. But all right,
I think the main thing we've never done is been really, really clear on roles and responsibilities of what it, you know, like having Susan mentioned this years ago, having an implementation blueprint, having a very clear protocol for when you're an embedded school therapist, what does that mean? What does that person commit to? What does the school commit to? What is the nature of that relationship? How do you hold each other accountable? And, you know, really have that spelled out. We've never gone that deep. And we, for the most part, I think they've kind of come into some of those great relationships, but not in all cases. And so if we want to have equality of effectiveness across schools, yeah, it would be good to do that.
okay, so assuming we're kind of okay with what we got here, we got about $6,000 we've got to find. Do we want to distribute the pain across everybody and take a little bit off? Or anybody have any suggestions for how to balance this out?
Well, clearly we can't take it away from people who've already given us a cut and we are funding them at the amount they reduced themselves to.
So we have 4. I mean, we've reduced the psych services, although there was no offer to do it from the applicant. But so if you say that we consider the Healthy Start having given us something back, we want to keep PATH whole. So we have 4 others that, you know, we could split that roughly 2,000 across those. I don't know what the, seems like it makes it the less painless, but anybody thoughts?
Yeah.
Yeah.
Everybody against, I mean, for $6,000, is everybody against using fund balance for that? Instead of
Well, at this
services
point,
more?
I think we need to bring this to the board without using fund balance and then
Okay.
explain that, you know, this is what we had to do. And I mean, we didn't, I mean, that's a thought, certainly, is to just increase the budget by that amount to avoid that.
And there may be, we haven't talked with our financial people at the department as to whether or not they could find this $6,000, or do we have to look at reserves? Is there some other place that they could find it?
Susan?
If I recall the budget correctly, we already have taken out $100,000 to put into mental health out of reserves in the 2021 budget, if I recall the budget correctly, because I think the property tax was only at 1.3.
So you're saying that our levy was reduced by 100,000? Susan?
No, the levy was the same. That when the budget was created, and I have to go into the other room and dig through a few papers, but if I recall correctly, that budget had $100,000 coming out of reserves to make it to the 1.4 million, because I believe it was only 1.3 on the property tax dollars.
Okay, so you're maybe saying that if we got some budget, some reserves in there already, maybe we just reallocate 6,000 of that into the grants.
You can confirm that. That sounds like a very reasonable solution.
Yeah, and I can't remember the reason why that was done that way.
Sounds good, though. Yeah, if it.
The other thing I keep asking about is, you know, and maybe this isn't even fair to bring this up now, but we did set money aside for the recovery courts.
Yep.
And I mean, and we, you know, if we're asking others to take a little cut, I mean, and maybe that's already a done deal and I shouldn't even be mixing apples and oranges, but we could also look at them and reduce that a little bit as well there. Just a thought, just to be fair across all systems.
We approved the budget already, so the budget of the 209 is already approved. So in order to do that, if we were inclined, I think we'd have to transfer money from that into this, which could be done, but so I mean, I think what we're coming up with is what we'd rather do is find the $6,000 either by budgeting moving some of the money already budgeted to come from reserves to be allocated to the grants and dropping that to like 90,000 or something.
No. The 1.4 that that is budget the budgeted, the 1.1. I'll have to go look at my
Where we are now. With the
budget. But if I remember the budget correctly, I think you got it backwards, Hannah. That the 1.4 total that we have for behavioral health, and that includes the money for drug court. That 1.4 already has 100,000 of reserve in it. So we're actually using 100,000 of our reserve just to try to get to this number already.
1.4.
I see what you're saying.
So, but yeah, you are if you add the drug court in there. So what I'm going to throw out here is what you kind of mentioned it earlier, Hannah, on some of these indirect costs, and you've got CHS has, you know, quite a bit of indirect costs. If there could be some overlap and maybe take it out of that indirect cost, you know, and look at and evaluate some of that to see if that is, you know, not the services, because we would want the money to go to the services, but is there any way to adjust that indirect cost that could find that $6,000?
Yeah, so basically the column H shows that, and those numbers include indirect costs. So column I now is not correct because the cost would have gone down. So the indirect cost for the psych would be
They're charging
47.
Yeah, they're charging 10% on their indirect.
I mean, the number we have of 471. So, I mean, in some ways, if you got to go back and say, okay, what are we doing in terms of adjusting the direct services, and then the indirects would go with that. But so what we have now is we're just saying the total budget would be 471. So we don't know at this point, the indirect cost would be whatever. Wouldn't be 47,000, would be 38 something or other, you know.
Did we not, when we asked these agencies to reconsider and submit a revised budget, the ones that said they couldn't change it, I mean, didn't they already tell us that that would impact services if we reduced anything, including indirect costs? That's how I read that. Is that how anybody else is reading that?
But if we're reducing their capacity to provide those services, would that not also reduce the indirect costs that are associated? They should have theoretically less indirect cost if we've reduced the 551 to 471. Does that make sense?
So for example, I suggested that we increase the reserves that CHS would use to 160,000. So if you do that, that takes 80,000 off of what we would be paying. So if we look at our number, I'm just trying to figure out how to do this because
I think it depends on where that 80,000 would come off of, because the 80,000, part of that 80,000 could come out of their indirect cost. So the original indirect cost was like 55,000.
Yeah.
they could take the 80,000, 55,000 could be from their indirect cost, or could be taken out, 55,000.
That was the point I was making, yes.
So we're okay with having, for example, psychiatric serve less than 300 people with our
I
money.
That
Correct.
we expected them to stay at the number that they said, 300. But
But
we're
haven't
only-
they already said they can't do that and won't do that? I mean, can we force them? So basically we're forcing them to, we're telling them what they have to put in on from their fund balance. Is that our role? That we are dictating to them that they have to use X amount of dollars from their fund balance?
unless
No, we're not doing that.
Yeah, we are. Yeah, I think we are. Indirectly, we are.
what we're saying is we're gonna grant 471,666 to you. We expect you to serve 300 people, but they'll come back like they have in previous years and say they can't be done and want to start negotiating.
I think we don't do that. I think we just say, we've compared, so we know that in previous years, the program costs have not changed dramatically from this year to the next year. What's different is they've chosen to budget less reserves as part of to cover those costs. And we know that. And we're saying, we just don't think we can pick up where you left off in use of your reserves. So however you cover the 80,000 less we're gonna give you is up to you.
But the thing, are we still then, and if they say, no, we cannot, with the money you've given us, provide services to 300 people, that puts us back where we have been. Do we then say, okay, we're not going to give you the money, you have to serve 300, which I think we'd had that conversation before, that we don't find that acceptable. So the number that we're asking them to serve, they may not be willing to add more to it. And I think we need to give a little thought to what our response will be.
I totally agree. That was really my point. And also, depending on what is happening across the agency, if they're using fund balance paying for other programs that we don't have anything to do with, they may have decided we're going to spend, $1 million out of our fund balance, but we're going to divide it up across programs. I get that is something that would be good accounting principles. And so I'm just wondering, can we basically tell them, no, you can't put fund balances toward another program because we're going to force you to put it towards this one?
Okay, so do you guys want to fund them at the full amount and cut embedded schools? That's where we're at. We can't fund them at their full request. And then also fund embedded schools at the level that's requested. So I think, we're just between a rock and a hard place here. And I think, if they want to say, well, we have to have more, we say we don't have more to give you. And what we hope is everybody gives a little to make services available. And,
or do we ask for the courts to give a little bit too and help there? Because again, if we're asking everybody else to take a little bit of a cut, I'm not sure why we wouldn't ask them to take a little bit of a cut. And I realize we kind of carved that out, but it's just in the interest of equity. It makes sense to me that they should share the same, whatever percentage we reduce across the board, they should share in that. And again, I'd be interested in your thoughts on that.
Well, and if I could ask a question, Susan, I think maybe you have the best recall. When we approved the budget for next year, did we have two lines, one for $553 for all behavioral health and a second line for court services? And was that at the amount here that we have of 209? Was that a separate line, or was it all part of the behavioral health $553?
It is a separate line.
We have to
I can go get my, I can go dig my papers out. And
I'm just saying that logistically it could be done, but we have to raise it and have to do a budget amendment because we're changing a line of the budget. And I think that it is time, but this may not be the time in the process to have a conversation about court services, because we've never done an evaluation. I think we basically have accepted what we were told they needed.
and that,
Why would we do that? Why would we hold them to a totally different standard than what we hold everybody else? That's the part I've never.
Exactly. And just so that we know, and the budget amendments, we do them, they do them at every county board meeting. But, and I think it's correct. And it should even be, it's a conversation we need to have. And maybe we jumpstart it this year. There's only so many dollars. Everybody else, we're reducing others' capability or ability or capacity to serve. Corey's right. What about your capacity?
Susan, remind me, the budget's been approved by county board or will happen this month?
this month. Hang on and I'll go get my paper.
No, I mean, I agree the sentiments,
It's been a real source of,
well, here we go about history, that's kind of, you and I and Terry, all the
Right.
of this,
I'm
so.
just trying to look at equity. I'm just trying to say if we're expecting like you said earlier, if we're trying to have everybody absorb a little, then it's less painful for any one. And so I'm totally on board with that. Let's see if we can spread the pain across everybody.
yeah, because it's $552, it's all the same pot. And
Unfortunately, we are at 1:00. I wasn't watching the time. And Judy, you said you had a 1:00.
a few more minutes I can stay with you, but
I'm sorry, I was not monitoring the time.
judgment of you guys too.
Because I was just gonna say, we have the budget for drug court is on our agenda, so go ahead, Susan.
Okay, the property tax dollars is 1.3 million. There's also 100,000 that's being taken out of unencumbered fund balance. So that actually for mental health is 1.4 million. Okay, and so the contractual services or for mental health services about 1.93, which is kind of where we're at, I think, 1.49. And I can't find it here. Oh, no. On the other sheets. I have to go find another piece of paper. But I make the suggestion of changing CHS's number so that we come up with a zero. The 471,000, whatever it is. Make so that we end up with a zero and instead of the 6,000 and see what that looks like.
I mean,
not
a little,
Quite following. 471,000? Not quite following what you want me to do.
Saying reduce it by $666 or,
by $6,300, is that what you're saying? Reduce it
Yeah.
by.
Yes. And so that we end up with zero down there.
Okay, and just keep in mind what we're setting ourselves up for here. If we
So
think.
take the full, so there's
Then you-
still 5,709 difference. So take that out of CHS. Is that correct?
Reduce the 471 by 6325, yeah.
we
Okay.
don't quite do that because
I'm not in agreement with that.
I mean, because we're setting ourselves up for something that we've done before, and it's raised a lot of concern among the public and.
And this is not a year to be playing hardball with when probably there have been cuts across the agency. So I would think we again try to find a way to equitably reduce across everybody.
So
So
Susan,
then,
you have the budget book there. court services must have the 209 in there as a transfer.
I think that that's been flat for so many years that that is exactly what they need on that. They've never, I mean, it's been years since they've even asked for an increase. So let alone to ask them for a decrease, I think that that would be pretty hard because of the numbers that they have in there. Those numbers are always the same.
Well, we have the budget for them and it's on our packet. Just gonna look at that.
But you know, the other thing, Susan, don't forget is we are constantly reminded that they should be recognizing some money coming back in, because if those courts are keeping people, are reducing recidivism and people coming back through the system, they should be starting to feel having some additional dollars generated that they're not having to spend on these people. And so that hopefully that money's being redirected into these courts.
You know,
That's always been that's something Dan Deneen has mentioned over and over and over again, that where are the savings being put?
yeah, and I agree. Could I speak? I'm sorry. I agree, Corey, and that's why we have to have this conversation with them. I don't think now is the time, but we must have that conversation with them in the future, going forward to the next year. But because if we are talking about doing that, we're talking about using, we would be reminded by elected officials that we have a reserve. We don't know quite now what it is or how much we're even going to use this year, but there is that perception that our reserve may be healthier than it is. And again, this is not the time we want to start having that all debated in public. So
but we're going to do a calendar this year, ladies, and we're going to have a calendar of exactly timelines of when we're going to talk to who about what, because I have had this same exact conversation for about 15 years.
Yeah.
I wrote it in my 21 calendar. I told you I would, Corey.
Okay. So Judy, are you needing to go? Can we keep you? What I was going to suggest is, I don't know whether we, at this point, I think we have a suggestion to take it all off of CHS's psychiatric budget. We have a suggestion to reduce drug court's budget. And then beyond that, I guess, would be trying to distribute this across the various agencies. So yes, ma'am, Judy.
And then since I do have a 1:30 appointment, which is out of my home, so I do have to allow some travel time. My suggestion and my vote at this point would be that we find the $6,300 in our own operation, whether that's reserve or someplace else. I would, that's where I'm coming down.
Okay. And as I understand it right now, the full amount budgeted is allocated either to drug court or to our mental health programs. So apparently from what you said, Susan, we don't have money even budgeted to bring forward like we did last year for some of the marketing. It doesn't look like.
Which is very unfortunate, because Judy and I had a fabulous conversation today with Karen Zangerly and David Taylor, and talked about possibly setting up almost like a triage for a path where they could possibly consider doing what they were calling warm, what do we call it, Judy? Warm
wine. Okay,
warm wine.
I remember asking when we were reviewing this budget, we had, those individual phone calls, if in fact the $50,000 for marketing and sustainability was going to be in this 21 budget. And I recall being told that it was in there. And now we're saying it isn't?
I thought it was in there too.
So Susan, you said we have 1.3, what is the property tax levy for mental health? Can you just give us the actual number?
So I was told from finance that we would have 1.193623, and then we took the 50,000
Say
out
that
of
again.
193 to get 1.143.
Okay, so it is somewhere. It's not in there, but it is somewhere in our budget.
The 50,000 is part of this money that we're talking about right now, the 1.143, it was actually 1.193. So the 50,000 is in this.
Oh,
Yeah. So there,
and I think what we do is we just consider that we have 6,000 more in this program and less in the other. And as that marketing gets going, if we feel we need to move fund balance at sometime later in the year, we look at it then. Isn't that the
so
simplest way?
instead of the 50,000 for the marketing and
Like
sustainability,
44,000.
63 out of that. Okay.
Well, and I would definitely say take it out of sustainability because I think we've got plenty of ways to use it in marketing. I would hate to take it out of marketing. So I
Well,
would say
and
But
sustainability.
does
right now,
that-
like, they're together. The marketing and sustainability, that 50,000 is together. It's not divided like 25, 25.
All right,
That's
good. All right,
totally-
okay,
Yeah.
all right.
But that's not split out in a line item in the budget at this point, right? It's just, we have so I think if we just say that we're gonna spend 1 point, whatever, add the 6 something to the, 1.2 something on our grants, then we will have slightly less that we'll have for that marketing. We're just getting those going. So, and if it blossoms, then we'll figure out that we'll pull more fund balance in later.
Mm-hmm.
That sounds good because what we heard today is they're anticipating very severe straits in the next months ahead because there's many people that are actually being driven to homelessness, and Mid-Central Community Action is out of money. So we are people that are going to not even be able to have that safety net that they've been counting on. So it's bad.
Well, and
There are
now the
some
question
short-
is this the year to put those aside for those kinds of, I mean, they're great programs, but should we have that 25 that we thought we'd use for sustainability, which we're not even sure what we're going to do, and put it back into our programs? That's another school.
No, because there's tons to do with the marketing because we're talking about actually establishing a warm line through path where people could call just to get support. And we're talking about mental health first aid training the trainers so that we have people that, because we're going to need people that know how to help their neighbors and friends. So everything we're talking about is very much service. It's going to be service oriented anyway, because the path warm line is going to be to support people who are having emotional issues. And the mental health first aid is going to help people know how to help friends and neighbors that are suffering. So I don't think we're taking away from direct services at all if we keep the money there.
Okay, so I think we're ready for maybe a motion and then we can get Judy out of here.
Can I ask one more time, what's the final amount we're giving to psychiatric?
That 471,666, I think.
And then, and when you guys are doing the motion, so when this goes to the Board of Health and we put together to show like what you guys are recommending to be funded and to not be funded, do you want us to notate that about the psychiatric, that's 80,000, asking them to take that 80,000 extra out of their reserves?
We're
So
not we're
No,
not telling them how to do that. We just use that as a way of figuring out what we would be comfortable with funding, since we know that that's what's going on. They will address that. And I agree with everybody else. We will have to deal with whatever PR comes from this, but I think that works both ways. I don't think it serves them well to continue to say the organization is so poorly run that we can't run it and find ways to fund our programs fully other than through this taxpayer money. So,
gotcha.
yes, Susan.
I'll make a motion, we approve this with the caveat on the psychiatric, on seeing seeing financial statements before the final contract is approved.
Can you?
just-
I second that.
See in the financial statement, you want to see the whole audit, 25 pages, what is it we want to see?
I want to see their whole audit. And I want to see their whole audit.
Yeah.
Like we've seen in the past.
I can't support that.
Okay, well, there's a motion. Is there a second?
And what's the motion again, if you could help me? I'm sorry.
As I understand it, Susan, your motion is to approve, and maybe we ought to break it down. Your motion to approve 471,666 for CHS is conditioned on receipt of financial information.
Prior to the contract. Yes, I guess.
So that's the motion on the floor. Do we have a second?
I'll second it. Whole seconds.
Okay. So any discussion?
Just that if that would get us that knowledge about their fund balance and how they're using their fund balance across the entire agency, right? Because that's the only way I'm going to support this is if we're also allowing them to show us that, you know, maybe that fund balance is already being spent down. I mean, first of all, they've been spending down their fund balance for years for this service. And so, I mean, I feel like, I guess I just want to make sure that this can work either way for them, that it's not just seen as a mismanagement on their part, that it could well be that they are using their fund balance for many other reasons.
It is because we are the we are the payer of last resort with tax dollars. And in order, it's the entire organization. It's not just this particular program that in order to get the complete picture of what we're seeing. And so I am basically trying to make sure we protect our tax dollars and that on this.
Is it necessary, though, if we're only interested in the use of their reserve and a history of that, that we say we must see your entire audit?
We've seen it in the past, and I'm not going to get into a whole long conversation right now on this. But like I said, you have to remember the past sometimes just so you know how to move forward. And that's all I'm going to say right now. And I can talk to you offline about it if you'd like.
So I'm going to weigh in here. As much as I have been frustrated by the lack of somewhat response to our request for information from this organization, I feel like for our purposes, we have to have some finality. And I guess I'm not sure where we go. If Susan, are you saying if we get something that makes us think they should use more reserves, that we would come back and then reduce the amount? Or are we saying we want this as a part of the contract, so we are being given this along the way, but we're proving the amount to be funded? And I guess I feel like we should make a decision on the funding now with what we have. And so I'm opposed to that as a condition for the funding. And primarily, I just think it leaves us in an uncertain state of where we're going.
Okay.
And I am sorry, folks. I'm sorry, I do have to leave. Hannah, I support that. So
Let's do any more discussion. If not, maybe we'll have a vote and on the motion. Any more discussion?
I can go with it be part of the contract that we get their full financial reports like we have in the past.
Okay.
but it not be a condition of what we're going to grant them this year, correct?
Correct.
Okay.
Okay, so do you want to just withdraw the motion, Susan, maybe, and then we'll.
Yeah, I'll withdraw that motion, make a new motion and say, let's approve the way it's written up.
Okay, so your motion is to approve, and I think, should we do these all as a group? To approve funding at the levels shown on column H on our spreadsheet. And with the understanding that the total available for funding will be, so is that the final number then, Amy? 1,220, 12202?
Mm-hmm. With with the need to find 637526, correct?
Which we're just going to
We're gonna find it.
ultimately what we spend on the marketing sustainability by that amount.
Mm,
Yeah, because we actually have 1.193 available. And that's not considering the drug court. That's after drug court.
Oh,
Muted, Amy.
What Hannah just said is the motion.
So we are down to, this puts us as exactly what we need, or after we
Yes.
take 6,000 out of the marketing sustainability? Okay.
Yes.
Oh, sorry, I was on mute. So I was trying to explain to you guys, when I put the asterisk next to this 70,000, and Jeff, like, if you're listening, please help me. But I put the asterisk next to that 70,000, and so that did not include it in that total amount. So when I took the asterisk off, we're actually at 76,000.
that we have to find?
Yep. So,
Okay.
but yeah, that's not being very savvy with Excel. But when I remember you guys told me to put the star next to the 70,000 in case we wanted to change that, and I put the star, it affected the calculations.
Oh,
And so-
no.
Yeah. So it's actually negative 76,000. So it's more than just that 6,000 we were talking about. Jeff, like, does that sound correct to you too? That putting this asterisk next to it didn't it didn't calculate it?
Correct.
Okay, so I wasn't crazy when I had all my numbers added up the way I thought they should be on that. Okay.
I thought that was too easy. I thought that was way too easy.
Bye,
Sorry,
Judy.
now we know not to put asterisk on the Excel worksheet for document for calculation purposes.
so maybe we need to not fund one of the embedded schools.
Or 2 or 3, unfortunately.
I think that's a bit extreme.
I think
know.
only
I said-
one. I think only one should come off, because that's again, that's right now with school, with children, families, and schools being under such duress, they need support.
Well, and that's what I had said earlier when I was looking at my numbers, that the way they added up is that when it came to since CHS, the increase was so high, so great in adult psychiatric, we were going to have to make a choice on whether or not we're going to fund schools. And so what is the choice? Do we want to fund the adult psychiatric, or do we want to do make sure that we get these early interventions? And that's we have to prioritize one of those two right now, regardless of, whether CHS asks for, a whole lot more and try to split the difference, is we can't fund all of this. And even if we added one school, we'd still have to come up with money. And so that's where, are we going to drop schools that we've been funding, kind of thing. So that's where I think I said that earlier, and I looked at my numbers and then got caught up in all this and totally forgot about my numbers that I had.
Yeah, because
So which one are we
Added
taking
a school
off?
this year.
Which one are we taking off? The school one? Because we added one, right? Which one did we
we
add?
actually did 2. We added Irving and Sheridan at 20, and we added Evans and Cedar Ridge at 20. And then we said, and then we added Bloomington Junior High at 20. That's 60 that hadn't been funded last year.
Well, and I would go back to Susan's comments on the embedded schools. It's clearly a challenge to do this as school is being operated, and I would just anticipate things being kind of wonky, at least till the end of this school year. Even if the vaccine comes out, it's going to take a while.
Long time.
Except,
So,
don't forget, except Hannah, they've been doing it all since spring. They really have. They've been, and they did it all summer long. They did adapt and move. So, and I think if we already took Project Oz, I think if we took Project Oz already out of the schools, and so that's a whole layer of support we've taken away from the schools. I think we need to be a little bit careful. I have no problem taking off another one entity, but I would hate to go much farther than that. because then we're also really shifting it away from kids altogether, other than Healthy Start. Well, and I guess suicide, but suicide to me is bigger because the suicide NAMI, Ending the Silence, also goes into other entities besides schools. She also apparently sometimes does presentations in congregate living facilities, etc.
I mean, the only thing I would say, Corey, is that I think they have the ones that were established and operating continue to do so, and that's great. They're talking about adding programs now, and as you said, the Fairview program had a terrible time getting started because you had staffing issues and COVID and the schools, etc. And those schools aren't used to doing this right now. So as much as I agree with you, I think maybe we don't start new programs this year with the embedded schools because it's just going to be difficult to launch them.
Mhm.
And
So
That
what?
may
Which ones? So what are you? How much are you doing? What are you wanting to do?
well, I'm just saying we had ones that had not been operating, and maybe we need to back off of those. I mean, we got to find it somewhere.
Well, maybe if we just not fund the Evans and whoever was with Evans, because I can't read the spreadsheet.
Cedar Ridge.
Cedar Ridge. I mean, those are needy schools, but Irving and Sheridan are much needier. If you
They
put
have people in there with Medicaid coverage, right? So they've got
They
counselors
all
in
have
there.
Medicare. They all have Medicare covered. That's how their billable services are. I would just say again, you guys, if we're going to start cutting and chopping on this, and I get doing existing relationships is okay with me, but I just also feel like sometimes we should just give a chunk. We could just pick a dollar figure, give it to Center for Human Services, and let they and the schools really pick the schools within this groupings that are really going to be dedicated to making sure they fully use those embedded school therapists. And
I am
And
not
let's-
comfortable with that.
okay.
Sorry, there needs to be some equity between the two school districts so that we don't get blasted again. And I'm comfortable with the ROE doing it, but I'm not sure I'm comfortable with CHS doing it.
I don't
Okay.
it puts them in an
Okay.
awkward position.
All right. Moving on. Well, then how much money? Let's just decide how much money do we want to put towards embedded schools?
Well, what do we had 76 shortfall based on the funding we had. Are the highlighted ones the new programs, Amy?
Yes.
Okay. I mean, the other option we have is we have money that has been basically we're not using right now, partly for marketing, partly for sustainability. Do we hold that money now? And I know that wonderful things are coming out of the marketing group. We know we're not going to spend the 50 that was allocated this year. It's going to fall back into fund balance. It would have to be budgeted back in at some point. But do we take the bird in the hand of money that is in the budget now to cover these programs to some degree, save Sheridan Irving, take 40,000 out of the other two new programs and find 30 in that area, that 1.9?
I would be comfortable only in going down 20,000 out of that amount that's been allocated because of things that we really, I mean, unless you can tell me how we can do this going forward, because again, we're talking about helping PATH get a warm line going, talking about funding mental health first aid in the amount of at least $25,000. And so that's half of it right there. And then if we help PATH get this warm line that people can call in just in the standing in the gap. So if they can't get into an agency because nobody's got openings, they can at least be talking to this line that's going to support them if they're not at crisis, but they need support. And so I would say at the very most, we should take out of that it would be 20,000 and take us down to, 30,000 for use. And that only gives us 5. And then we talked about having neighborhood liaisons and giving them $1,000 stipends for 4 people. So, I mean, I hate to go below somewhere around 35, 40,000, or we won't be able to do any of that.
Well, my thought, Corey, is, again, we'd have to approve it later, but we have programs that are going now that we have in place, and those programs are great. They're in the making at this point. And that whether we then say, okay, we're going to need to develop, and we don't know whether some of those programs could be funded through other sources or partnered with other
Well, we
people.
are talking about mental health first aid. We're going to share with AHAC. I mean, we've already talked about partnering. We're not leaving that conversation out of this. I'm
No,
just
no,
saying, I don't want to go below $30,000 in that line item to be able to do things. And so I say, take 20,000 out of it. And again, we've talked, again, we keep talking about stuff, and then we never allow ourselves to do it. And I'm just to the point where I think we're really ready to finally springboard this forward. And so I hate to stop it again. And because the reason why we're doing it now is because of the intensity that everybody is knowing is coming at us this winter for behavioral health.
And we know that we have, let me think about this. We have 50,000 that was budgeted this year that's not been touched yet.
But that's what I thought we were talking about.
No.
He's talking about using 35 out of
Next year's money.
That's what I'm
2020.
talking about.
What are you talking about?
Well, I guess I'm talking about I guess what I thought was that money had to move forward into 21. And so that's what I thought we were talking about, the same pot.
We have 50,000 now that has not been spent.
Okay, but that's what I'm talking about. 35,000, at least 30,000 of that, at least for now.
Can you spend 30,000 between now and December 31st?
Well, we could spend 25,000 right now just on mental health first aid and mental health first aid for youth.
By the end of the year?
Well, because we would buy training time.
Yeah.
I mean,
By the
and
end
we
of the
would
year.
buy a block of seats so that
Okay.
the trainings wouldn't occur before the end of the year, but we would buy block of seats for we would be banking blocks of seats in the training. And then yeah.
Go ahead.
Well, no, I'm just explaining that.
I'm just saying that we have some money this year. Can we spend it in some ways to can we amend the Bloomington contract that is now only for the part of the year to carry them forward? Can we use this year's dollars to amend that contract?
You talking about Bloomington Junior High or
Yeah,
Bloomington High School?
part year.
Which one's the 83? Which one's the 83? That's Bloomington High School.
high school.
But Corey, what I was saying is that in the 2021 budget, we have again 50,000 that is part of the pot.
Okay.
We're only allocating 1.143, and we have 1.93. So we have 50,000 that we're not using to fund these programs, which is
and we currently have 50,000. So altogether, we have $100,000 for marketing and sustainability between this year and next year. Is that what you're saying? See, that's what I'm saying. No. And that's why I'm very confused, because what I'm saying is right now for the rest of this year, we could spend $30,000 easily, immediately to do mental health first aid for trainer of trainers training, 2 of them, and buying a bank of seats. We could easily spend $30,000 before this end of this calendar year. But then we would have nothing going forward to try to do this warm line that Karen Zangerly is very excited about, and to talk about training and giving a stipend to these community liaisons as a pilot, where they would go in and really try to dig deep into some of these impacted neighborhoods to reduce stigma and to educate them on what's available and to use mental health first aid training and all that kind of stuff. So I just don't want to lose that part.
We have 1.193 plus the 209 for drug court. Is that correct? Or Susan?
Yeah, it's the 1 point, if you add the 50,000, which finance just figured it would, if it wasn't spent this year, then it would go into next year at 1.193.
No. It doesn't work that way. The money that we budgeted this year If we don't spend it, it goes into fund balance.
Okay, well
We
then it might only be the
budgeted
1.13
again.
then.
So we do have that money available this year to use
Mhm.
as we had intended, and next year we will have another 50,000 budgeted already. Yes.
But that's not how they did it. So it
No,
may be
how
1.143 then.
is the 50 in our budget for 2021?
So I'm just telling you the way that finance explained it to me, so I would need to clarify it with them, is if we did not use it this year, so they didn't put it into
Okay, so it's not budgeted.
a fund balance. They adjusted to put it into the funding allocation for 21. So it's only 50,000 whether it's used this year or next year.
Okay, then I'm really opposed to cutting into that very much.
Well, I'm totally lost then. So we have
We have
209.
$50,000 to spend for this, the rest of this year and all of next year to do marketing and sustainability. We have $50,000 period that's going to cut
It's
across.
$50,000 period. And I'll text this finance supervisor real quick, but yeah, it's 50,000 period.
Okay, here's my question. 2020, we had the money for the grants and we had 50,000, which we wanted to use for these other programs. We haven't spent the 50,000 that was allocated yet. And I know it's probably budgeted as a transfer from fund balance, so this is probably what's going on. It's shown in the budget, but it's shown as a transfer probably. So, and if we don't spend it, nothing happens. It doesn't get transferred. But if we spend it, it's spent. We'll do the transfer and we'll use the money. In our 2021 budget, what you're saying is that there is not a transfer from fund balance for 50,000 for this.
So
I have the document in front of me. You can see it in there if you are looking at it. I mean, are you looking at it, Susan, or are you just, no?
So the way that you explained the first part was correct. And then the way that finance explained it to me, which maybe some of it's because Kathy Dreyer isn't there anymore. And so maybe they're doing things differently. But the way that it was explained to me was that it's just 50,000 total, whether it's used in 20 or 21. And that the 1.143 is minus that 50,000, but it's 1.193 with the 50,000. So the way that it was explained to me was that if we don't use the 50,000 for 20, whatever isn't used is going to be added to the 1.143. But I can check again, but that's the way that it was explained to me.
Yeah, well, that's not how the budget is built. That may be how people are thinking about it underneath the budget, but the budget appropriates money, and so you can't budget that way. It's got to be shown in the budget either there or not there, so.
So can I
It
just
was
ask a question?
Never
So,
budgeted.
so go ahead, Susan.
Let's wait a second. Corey, can I let Susan weigh in on the budget for a second? Thanks.
I don't think it was budgeted in the budget that was approved a year ago. And so when it came up with this, it was when we approved our funding for this year, we approved as the Board of Health the 50,000. And so it was already included in last year's budget, overall budget.
Mhm.
And so the Board of Health, though, decided we're going to take this 50,000 and use it for that. And I thought it might have been coming out of reserves, but we never did a budget amendment in order to actually transfer that money if it was in addition to that original amount that we approved. Because I didn't think this actually came up really until past beginning of the year after the budget got approved. I can't remember exactly the timing on some of this. And so,
It was in there before.
you know,
No, it was in there. I remember talking about it because talking from my end, I remember saying, what are we going to do with the money? I mean, we had and you know, I thought it was in the budget approved last year. But
okay,
I'd
so it
have
was
to look
approved in the budget. And
I-
so
that
if
The
we got
budget for 20.
budget. Does anybody have a budget book? That's the easiest way to look at it. And I mean, Corey, I understand what you're saying. If we did not budget the 50 again for this year, then yeah, we'll either have to spend it this year and then amend our budget to include fund balance for next year to cover things. But so this may just unduly complicate matters for figuring out what we need to do today.
Well,
So-
all I can tell you is since we have decided marketing was critical because we know we got this group of underserved people, stigmatized situations. And so we've come up with some ideas that I think have real legs to them. I think they're very doable. And the people that would be part of implementing them are really on board. And so I think we could move pretty quickly. And one, again, is the mental health first aid trainer of trainers and then lack of seats. One is doing the warm line at PATH, which would do some of the things Susan's been talking about. Like, what are all these people out there that have all this stress for the first time in their lives, don't know what to do with? Well, we could create this line at PATH that instead of doing deep dive into deep-seated issues, can just call and get support. And there would be somebody that there would be people that's what they know that they're signing on for when they become PATH volunteers. And then the other thing we talked about is right now there are some billboards around town that are advertising the 211 campaign. And Karen has those paid for through December, but then she does not have them paid for after that. So we talked today about possibly finding a way to pay for those billboards for the first quarter, because at least we know this pandemic's going to still be killing us all from January to March, and just committing to that. And making sure too that we think about billboards that are very strategically located as they tried to do in the first place. So those are some very concrete, very doable things that I want to make sure we've got some dollars to support.
Okay, so I think what we're back to is we won't talk about that money as far as how to deal with what we're gonna find here is money. So if we take out the 20,000 so we keep the 20,000 for Irving, is to take 40,000 out to take those two other embedded schools programs out of this year's funding.
Amy, how much are we short? I thought we were only short 7,000, not.
No,
we're short-
76,000.
How much?
76,000.
Oh, 70, I'm sorry.
Can you put the spreadsheet back up, Amy? It's gone.
Yes, I'm sorry. I was trying to see if I had an answer for you guys in my email about the 50,000. It doesn't let me look and share at the same time.
So if we take 40,000 away from embedded schools, then we're now down to 30,000. And
Take
Don't
away from
forget
what?
the
Embedded schools?
Amy, you need to highlight the 8333. Aren't we still going to do that? You didn't highlight the 8333.
So they told me to highlight the ones that would be new for
Oh,
2021.
you're highlighting the ones that are going to go. Okay, gotcha. Sorry.
The ones that, yeah, the ones
Okay,
that
I'm sorry.
being-
My fault.
being funded right now. Nope, you're fine. So
My fault.
there's 3 right now that aren't currently being funded. So which ones were you talking about taking away?
there seemed to be a sense that the Sheridan Irving was an important school to be present in.
Okay.
So I'm just talking, I think that's what the group has said. What are people's feelings? And then take 2 of them out, which leaves us, what, 30 something short still?
36,499.02.
And then let's look at our equitable distribution because Carla, everybody's right. We need to look at that. So what's Unit 5? What's District 87? What's Olympia? So we still have Olympia and we have what, two Unit 5 and two District 87. Is that accurate?
So right now we would have, we have Irving and Sheridan,
Which
Is
is
that-
District 87,
Kingsley Junior High and Oakdale.
Unit 5.
And then let's see, Parkside Junior High and Fox
Yeah.
Creek.
Unit 5.
and then Bloomington Junior High.
Okay, so we're okay. We're okay.
And finance just said that she just said she left the $50,000 in revenue for fiscal year 21, for calendar year 21.
But there's only 50,000 period.
Yes.
Right, okay.
Wait, 50,000 revenue from fund balance?
So, and I talked to her before about fund balance, and I don't think that was something that was really transferred between Kathy and the current finance supervisors, like that language, but,
So we
She-
have revenue that comes from property tax dollars. When she says there's 50,000 in revenue, where's it coming from?
I don't think there's,
I mean,
it's not revenue. She used the wrong word.
so you want to know where the 50,000 comes from?
Do you have the budget book or the actual budget
I don't.
that was approved? I mean, that will answer all these questions.
Yeah, but you can't. Only Susan knows how to read the budget
I
spreadsheet.
know how. I'm sorry, but
Okay, good.
I built several of them when I was in the administrator's office.
Well, the thing is
Good,
that,
look at the two of you.
50,000, right, the 50,000 comes out of the fund balance.
Okay, so that is shown as a budgeted amount for 2021.
Oh, these were the ones that weren't fixed though.
that's where I said that there's a $100,000 that's coming out of fund balance for 2021 in the budget. And apparently it must be 50,000 of that must be for what we're just talking about.
Marketing.
And so I don't know what the other 50,000 was for because I can't remember. And I didn't write those kind of notes. And the budget's very hard to try to decipher some of this stuff anyway. It's not like it's earmarked here and earmarked here, kind of thing where it's detailed out like this. And that's why it's hard to.
But I think that, I could talk to somebody, but if our 2020 budget showed 50,000 budgeted, and I think there was talk about maybe having a person who might do marketing. It was a marketing issue, as I remember from last year. Then that money's available still to be spent this year. And if in fact we also budgeted 50,000 for next year, then that will be available January 1st.
I don't think we budgeted an additional 50,000 for next year.
Well, that's what
No.
Amy, yeah. Without looking at the budget books, it's hard to.
So I'm waiting she's responding now as far as like, there's only 50,000 total.
But it's got to show in the budget. I mean, so if there's a budget of 50,000.
Also, our committee needs to know when we got to spend it. I mean, does it have to be spent by
Yes.
December? Or, can it carry forward? Because we're going to have a bunch of this we could prepay or pre-do between now and December, but there's a whole piece that we can't do until next year.
So the way I look at it is this: we had a 2020 budget, and without a book in front of me, if we budgeted 50,000 from fund balance, so we had whatever 1.193 million budgeted for mental health in that program. Then if we didn't spend the 50,000, it just drops back into fund balance. We start all over again January 1st with the new budget, which now has 50,000. Now behind the scenes, we may have thought, well, we didn't spend it last year, so we want to budget again for the same expense this coming year. But, we didn't anticipate what we're dealing with here either. So there could be money that's actually been appropriated that we could use. That's what I'm saying. And I know that sounds like gobbledygook, but.
So her response was that there was 1.193623 approved for mental health services, and 50,000 of that was intended for the pilot projects, the marketing sustainability that were supposed to happen this year. So they moved that 50,000 from this year to next year.
No.
So it's already been moved. So we can't access it until January.
They can't move the money that we had budgeted last year to the new budget. What I'm saying is that there was probably an expectation that that wasn't going to get spent. So we agreed, well, we'll do it again. We want that to happen. But that 50,000 is still there to be spent this year. That's the question, I guess, that we need to be clarified. And if it is, then we spend a bunch of that now for some of the things that you thought you'd spend next year. And maybe we can use, because we really want these programs to be funded, we cut into that 50,000 that was in the budget for the marketing thing, because, you know, we're already really spending it. So it's 1.193 million that we have, and
I just feel like we're going around in circles. So basically we have to decide, are some of the services that we're looking at on the screen, are they more higher priority than trying to do this thing where we would have, again, a warm line at PATH that would be available to everybody in the community, that we would have mental health, first aid, trainer of trainers. So we would have more trainers for both the regular mental health first aid and youth mental health first aid in the community. So, because we've lost a bunch of trainers, we're down to about 6, and we need at least probably 6 to 8 more, and we want to get them trained. Then we would also need to pay for seats. So then once we have trainers, they want to do 1 training a month for every month in 2021. Yeah.
can I just stop
I'm
you?
just trying to outline, to me, are those high priorities as well?
Well, let me ask you a question. The warm line at PATH, is that something PATH will be doing? I mean, I'm hearing things that may be funding going to, but let me ask Amy a question. Is your finance person saying there is 50,000 in this year's budget to spend on these programs?
So what she is saying is it is just 150,000. So it could be spent this year, or it could be spent next year. It's just 150,000, but the timing of when it is spent doesn't matter between this year and next year.
So that would suggest that the 50,000 is in this year's budget. And we have 50,000 in next year's budget.
No, there's only one.
No,
That I'm saying, right?
no, it's only in one. Amy, is it our budget person or the county's budget person?
It's the health department's budget person.
Send her the link to this meeting and tell her to sign on.
No.
What do you mean, no?
I mean, I'm just saying, that's, the important thing is we do have the 50 to spend this year, and please spend it, Corey. You know, so.
Believe me, I'm going to be moving heaven and earth.
Carlin, I'm sorry. I just think, you know, I think it's either, let's look at what we know we have. And I guess if, you know, if there's some uncertainty about whether or not we got that additional 50,000 in next year's budget, that whether we have 1.9193, then we need to budget as if we don't have it and figure out who gets cut.
Yeah, I would say, Corey, spend your money now. And I think that they probably made the assumption that wasn't going to get spent, so that's why they pushed it over into next year's budget. That happens a lot in a lot of things, but it was budgeted this year, so spend it if you're going to spend it on something. And we don't have it for next year for that particular thing. So we have to kind of, but it still comes back to our priorities here on these schools. And then we increase CHS's adult psychiatry, you know, 80,000. So at the expense of schools. And so that's back to where we were at the beginning of the meeting.
Somebody want to make a proposal of how to make this up? I mean,
Well, again, did we ever decide to kind of carve off a little bit off of everybody? other than the ones we'd already had, that already submitted reduced budgets? Did we ever even go there? And maybe it wasn't that much, because we're not really, we can't really carve anything out of the embedded schools because we already cut some. So the only place we could take that out of, would we take any away from crisis? Would we take any away from NAMI and in the silence? I mean, if we took what, just even 10% or whatever? Or even, would we even go that high?
That's, I propose that we take the 30,000 out of adult psych. 36,000.
In addition to what we've already cut?
Well,
Yeah.
Because I
So
guarantee,
what does that bring them to, Amy, if you reduce them by the 36 that we have to find?
499.02, right? Something like that.
If we take the 36 that,
are you taking it from the 87.9 or are you taking it from the already reduced amount?
Already
don't-
reduced amount.
so we have
Wow.
471, 666, and then we take it down by, take the 36 out of that. So it leaves them at 435, 166.
So we're taking them down by what they asked for, 38, they asked for 551, and we're taking them down over 100,000. Well over 100,000. No, yeah.
Either that or it's either that or get rid of Irving and Sheridan and 10,000 more dollars. 16,000.
Well, I'm just saying, how many psychiatric clients do you want to cut? Because they're going to come back and say they're not going to be able to see 300 people, I guarantee. We're going to go back into the loop we've always gone into.
Okay, what's your proposal, Corey?
Well, I guess I'd still like to look at carving a little bit off everybody, including recovery court. And I think we already said forget that, but I'm just saying if we took a little bit off of everybody, we could at least make up some, even if we could get another 20,000 off by doing that, 20 to 30,000 by taking a little, shaving a little bit off of, other than Healthy Start, which we already cut, right?
Right. I see we're going to get $20,000 out of that budget
Well, let's see if we took,
without, I mean, it's going to have to come off of PATH or mobile crisis. Those are the only two things that didn't get cut.
well, and again, though, remember that they both said they could live with that. I mean, they did submit amended budgets. And so maybe we let them do that, because PATH said they could go down 18.7 basically. And NAMI said they could, well, they did say they couldn't go down. Okay. All right.
But
And
Path, but
just
Path would
remind-
lose texting then, and you would not have texting ability with Path, which is something that
Yeah, you're right.
in this environment is very, very important.
No, you're right. You're right. Okay. All right. Never mind.
I don't think we have a choice here. I mean, we only have so much money, and if, this is what we have, and this is what we have to deal with in this environment. You don't want to cut mobile crisis or PATH, either one, because they are very critical right now and will be for the next year. So, and the kids are, so if you want to not fund some schools to then increase the adult psych, that's your choice. I mean,
I know.
whether we like it or not, that's what our choice is.
I agree. Okay. And I mean, I get that. And how, where my heart is, but I also just know I think we're going to hear that they're going to cut significant numbers off the 300. And then do we just live with that, or do we go back to what we tried to do last year and it never changes?
Well, and let me just say, I just looked at the psych budget. I mean, the direct service budget is 480. And the rest of it was the indirect costs.
Okay,
So, they may have to make a choice too, as to whether they just sort of, and, we're giving them indirect costs in the mobile crisis. So, I mean, I think it's the best we can do with what we've got right now. And, that it's not like we're trying to punish anybody or do anything. I think, we're looking at this,
oh, I know, it really is choose between, do you want to give away your son or your daughter? It's tough.
so.
Amy,
how
when
we
you
feel-
put the spreadsheet out for the board, can you put a line item in there that shows that there's already $100,000 coming out of fund balance? I don't want to have this conversation in public again.
So, okay, so you want me to check with finance and know exactly where the 1 X amount is coming from?
Well, no, I mean, we all know where it's coming from. It just that there's $100,000 that they took from, so the property tax was I'm going to make a mistake.
It was
Was
the-
one
it- what you see is the prop-
04, right? This just property tax was 1.04 and change.
So
No.
probably. So Susan, I'll probably reach out to you to get the numbers that you were talking about and check with finance as far as like the numbers you were saying that the 100,000 was pulled from fund balance to this. And finance, I'm sorry, like finance isn't my area of expertise, so I'm leaning on them heavily to just tell me how much money there is and trying to not make it as confusing to you guys.
What they're supposed to do.
I think if we have the budget that was approved in 2020, you'll see it'll specify revenue as property tax or fund balance. And then we have a budget that we approved and will be approved this month by county board that also will show those numbers. So, we can get that'll show us. I mean, that guides what we do in the long run. I mean, some of this, what we know we talked about is the right reason behind it is different.
Right, I'm just trying to make it visually apparent to everybody.
So you were saying, what would be the
That's all I'm
purpose?
talking about.
Carla, you would do that so that you're saying, well, 1 point whatever was property tax and then 100,000 is fund balance. But yeah, Susan, you mentioned that earlier and now I'm lost on that.
Okay, so if you go back to our September 9th Board of Health packet, it has the budget in it. If you go to page 73, you'll see on there, there's $100,000 from unappropriated fund balance as revenue.
September.
And so, Hannah, you can go look at that after the meeting here. And that's where I'm saying that we're already putting in $100,000 out of fund balance into mental health.
And that was the September
9th, page 73.
Okay.
Do you all think that if I could say that, like if I'm trying to get these liaisons, this pilot peer liaisons, that it's unlikely that they may be identified by the end of the year? That would be my goal, that we've got 4 people identified. But I'm guessing training is, nobody's going to want to be trained in the month of December, et cetera. So if we assume that we're going to give them a stipend and there's money there, is it safe to say that if we took 10,000 away from that 50,000 and gave it back into this system for now, that we could allocate when it's time to start paying them for their small stipend with, accountability attached to it? Could that be reallocated next year? Could we take
Don't.
that out?
Let's not do that.
Don't do that. Okay, so then just leave it alone. Then I retract everything I just said. Never mind.
I'm just trying to, I wish we weren't public.
It's okay, nobody.
Well, that's true.
Don't say
If
it.
people-
It's recorded
People are
though.
gonna say to us,
It's recorded.
okay, people are gonna say, okay, I'm the taxpayer, so I'm gonna speak as a taxpayer. You're not funding adult psych, you're not funding all these services, you cut a lot of services, and you've got this surplus. Well, but if we put that on there, we've already put in 100,000 of our surplus, of our fund balance, sorry, as of our fund balance. That's the only reason why I want to show that 100,000. Leave the 50 alone to do what Corey needs to do with it. And then I don't know, we either knock off another school or we knock off money off of adult psych. Right?
Well,
That's what we're talking about doing. That's the choice that we have, right? Either take 20,000 off of adult psych or knock off a school.
well, that's what we've done right now. I mean, what we have in column H is what we would do, basically staying within our 1.43. That's what we're going to recommend to the board.
And I wish I knew whether there was going to be anything in the Illinois budget to do mental health, because Pritzker keeps saying, school mental health, and also Biden keeps saying school mental health is a big deal, but we got no guarantees on anything.
Okay, snarky comment, get real. There isn't going to be any more money.
I'm right there with you, sadly.
So does anybody want to make a motion to approve the funding to the agencies at the levels depicted in column H?
So moved.
21.
So moved.
So Paul moves, Susan Schaefer second. Do we want to vote? Any discussion?
So just so I'm clear, the gray schools are being funded, the yellow schools are not being funded, correct?
The ones with
No.
zero,
Yeah.
Okay.
zeros in those that are not.
Okay, so we're funding how many schools altogether? 5 or 4?
5.
5 entities.
Six.
Okay.
6. Right? We picked up one.
Nope, 5.
We put 2 back. There, yeah, it's a total of 5.
Oh, 5, okay.
All
Sorry.
right. Okay. Thank you.
Okay, I think we have a motion to approve, recommend to the Board of Health funding for the agencies listed on the spreadsheet and the amounts listed in column H. So, and any further discussion? Okay, you want to take a roll call vote, Amy?
Sure. Susan Schaefer,
Yeah.
Tina Eisner,
Yes.
Corey Tello,
Yes.
Carla Pohl.
Yes.
All right. And I
Do
think
me a
now-
favor, just use that spreadsheet, add a line down at the bottom for the 100,000 for fund balance. And submit this in the packet.
Well, why
I
don't we let me work on it and see, we might want to clean this up a little bit in terms of the information that's, but, I agree, let's put it out there. I think publicly, you're right, Carla, if we are using fund balance already to cover these expenses, then, let's make sure it's known as a part of what.
I very much appreciate that, because again, if we're expecting agencies to be dipping into theirs, then we gotta join them in the pain.
Okay, well, guess what? We have one more action item. Which is to approve the, we have approved the budgeted, we have budgeted money for drug court. And so what we are looking at is the actual allocation of those dollars. So it was in the packet that Amy provided.
Yeah.
So I don't know if everybody can get to that.
I'm working on it.
I'll make a motion to approve drug court.
Second,
So, okay, and who seconded?
hold it.
Okay. Any discussion?
Yeah, I'd like to add a caveat that we have a discussion with them about savings they may have realized by diverting people from recidivism in whatever form. What's happening with those dollars, that we would like to have that conversation that's built into, I don't know, are you still doing a contract with them, Amy, or was that now it's just a transfer of money?
So between the Board of Health and Problem Solving Courts is an MOU.
Okay, so can the MOU, can that be included, that we have something that says that we have a discussion about what they do with them, how they evaluate or keep data on savings that are realized from people not going back into the system over and over, and what they do with those savings?
What really happens is that the people who graduate out of those programs, they just add more people into the program. So they've always got a usually, 40 or 50 or whatever the number is, people in those programs. They always continually have those number of people. So any cost savings is just put back into doing that continue.
I know, but you're still saving money in that 40 or 50 people each cycle are not getting in more serious trouble and are not requiring them to have higher levels of either, case management or court involvement or probation officer time or whatever it might be. So I'm still thinking there's got to be some savings realized, because each group of 50 while they're there are supposedly not using a high degree of service.
So
I just would like to have that conversation. And even if they say exactly what you said, I'm good with that, but I want to have that conversation.
So Carla, Madam President, would this be a bad thing to have them come to the meeting and give us a report? Let the board?
I think it'd be great. We had
Did
talked
you-
about that before anyway.
That might give us it's not quite what you're asking for, Cory, I think, but at least give us their numbers and explain how people, how the graduates are doing. And as you said, are they now avoiding the need for these kinds of services? So.
Yeah, we know that services are never going to go away, but we also are assuming we're keeping the level of service at a lower level, which should be cost savings in the long run.
It would seem like, since we're looking at their budget this coming meeting, that might be appropriate, but I don't know what else we have for the agenda.
I think we can probably get them on. We only have 2 other agenda items plus this.
Okay.
That I know of. I should read. It's early yet.
Is that Wednesday? No, that's next week.
No, it's on the 18th.
18th, that's right, we moved it. Okay.
18th. It's not next week.
So I think we got a motion on the floor. Any other discussion? Ready for a vote? Amy?
Susan Schaefer,
Yes.
Tina Eisner,
Yes.
Cory Tello,
Just with that caveat.
Carla Pohl,
Yes,
and just to clarify, I need to invite Mike Donovan with Problem Solving Courts to the November 18th meeting to discuss the program. Is that
yeah,
correct?
give us, how's he using the money and how are things going?
And
Okay.
again, are they doing some way to assess cost savings from the idea of having the preventive pieces or the minimization of severity that comes through problem solving courts?
The savings, Corey, are probably coming out of the jail.
Yeah.
Had to guess, right?
Yeah.
Isn't that where they'd be if they were in problem solving courts?
You would
That or
think,
prison.
yeah.
And I don't know if Chestnut is
prison.
doing some long-term or longitudinal work on that to see how the graduates are doing over time. I can't remember if they have some, I think they do.
But I mean, I do want them to speak specifically to, do they do any kind of measures of that they are, having some savings based on using those services to minimize severity and therefore reduce costs.
Okay. I think we've ran it through our agenda. Anything else for the cause?
Is it time to take a nap yet?
Yes. And
Time
just
for
to,
lunch.
and I did, and I'll, per Carla, I will have, and I'll let Jessica know about the 100,000 fund balance request, but finance did let me know that that 100,000 of fund balance was 50,000 for the marketing sustainability, and it was 40,000 to increase the contract funding for 21, and then 5,000 for mental health first aid training manuals. So that's what that 100,000 that you guys saw in the budget was. The 100,000 fund balance, that's what you guys saw.
Thank
Okay,
you.
so that's our 2021 budget. thing.
Yeah.
Okay, so yeah, so we, okay.
I move
So
we
let me just be clear. So there's, for next year, there's $5,000 allocated for mental health first aid materials for next year,
No,
or that's this year? That was this year.
That it says for 21, and I think there's usually is money in the budget to health first aid supplies, not at the extent of what the marketing plan is talking about, but
No. But I mean, I just want to make sure we're not, so I guess what I'm saying is for next year, there's already $5,000 set aside for mental health first aid materials. Over and
Yes,
above
but
the 50,000.
yeah, 5,000 for mental health first aid training manuals.
Okay, because I don't want to double dip here. Okay.
Okay, and so there was 40,000 additional dollars for the programs.
45 additional thousand for the funding.
So, and to your point, Carla, I think it's 45,000 in fund balance that's going towards the actual grant,
okay.
not 100,000. Okay, anything else? I think, maybe for December, we ought to, everybody put on their calendars, look kind of whether this committee needs to continue to meet, but I think it'd be helpful to look at the school and start to really think about how we can set it up for next year to maybe move it over into an ROE or each of the districts. So, well, thanks everybody. It was a long one.
Thank you.
So we will see everybody, I guess, on the 18th. So,
All right, thanks guys. Have a good couple weeks.
be well.